Ladies and gentlemen, we once again request all of you to please maintain silence, kindly settle down. Our chief guest will be joining us in any moment from now, so we request you to please put your phones on silent mode. Kindly find a seat, sit down, make yourself comfortable, and please maintain silence. Thank you. Ladies and gentlemen, an announcement. As and when our chief guest will arrive inside the hall, we request all of you to please welcome him with a standing ovation and a thunderous round of applause. So as and when he enters, please let's make sure that we all welcome him with a standing ovation. Thank you.
Hello, hello.
Ladies and gentlemen, our chief guest has arrived. Let's welcome him with a thunderous round of applause and standing ovation. Chief guest Shri Parshottam Rupala ji, Honorable Minister Fisheries, Animal Husbandry and Dairying. Special guest Dr. Loganathan Muruganji, Honorable Minister of State of Fisheries, Animal Husbandry and Dairying. Kindly keep the applause going, ladies and gentlemen. And other esteemed dignitaries on the dais. We extend a very warm and hearty welcome. Thank you very much for gracing this event with your benign presence. आज आप समय निकाल कर आए हैं, आपका बहुत बहुत शुक्रिया. You may please sit down. We thank our chief guests and other esteemed dignitaries for inaugurating the digital exhibition on initiatives of the department. Distinguished invitees, assembled delegates, members of the media, ladies and gentlemen, on behalf of the Department of Animal Husbandry and Dairying, I extend a very warm and hearty welcome to all present here at the launch of the Animal Pandemic Preparedness Initiatives. Can we all start with a round of applause? I'm your host Preparedness, and I'm delighted and privileged to play host to such an accomplished audience. Thank you very much for taking the time out and joining us for this very, very important initiative. Ladies and gentlemen, we are here to address this very critical issue that affects not just the well-being and health of our animals, but also our own. Recent outbreaks of animal-borne diseases have shown us the devastating impact that can have on our food supply, our economy, and most importantly, on the lives of our beloved animals. But we are here not to dwell on the negative. We are here to discuss, to deliberate on the positive, the proactive measures that the Department of Animal Husbandry and Dairying are taking to mitigate the risk of animal pandemics. The Animal Pandemics Preparedness Initiative includes enhanced monitoring, improved biosecurity measures, increased research and development of vaccines and treatment for animal-borne diseases. Today, we have an exciting lineup of speakers, experts who will be sharing their insights and expertise with us. So without any further ado, let's kickstart this very important event. We will now take this opportunity to welcome the esteemed dignitaries present on the dais. I request Shri Rajesh Kumar Singh, Secretary, Department of Animal Husbandry and Dairying, to please welcome our chief guest, Shri Parshottam Rupala ji, Honorable Minister of Fisheries, Animal Husbandry and Dairying. आइए जोरदार तालियों से स्वागत करें माननीय मंत्री श्री परशोत्तम रूपाला जी का. धन्यवाद सर. I now request Dr. Abhijit Mitra, Animal Husbandry Commissioner, Department of Animal Husbandry and Dairying, to welcome our special guest, Dr. Loganathan Muruganji, Honorable Minister of State of Fisheries, Animal Husbandry and Dairying. A very warm and hearty welcome to you, sir. I now request Dr. O.P. Chaudhary, Joint Secretary, Department of Animal Husbandry and Dairying, to welcome Professor Ajay Kumar Sood, Principal Scientific Advisor to the Government of India. A hearty welcome to you, sir. I once again request Dr. Chaudhary to welcome Professor Dr. Atul Goyal, Director General of Health Services, Ministry of Health and Family Welfare. A very warm welcome to you, sir. May I now request the respected dignitaries present on the dais to kindly light the ceremonial lamp, to please light the lamp. With the lighting of the lamp, we invoke the blessings of the Almighty to bless the launch with the light of knowledge, wisdom, and truth. We pray for its success and wish all our participants a fruitful and learning experience today. A round of applause, ladies and gentlemen, as we light the ceremonial lamp and inaugurate the launch for the Animal Pandemic Preparedness Initiative by the Department of Animal Husbandry and Dairying. Thank you very much. Dhanyavad. To officially welcome everyone at the launch, I now invite on the dais Dr. Abhijit Mitra, Animal Husbandry Commissioner, DAHT.
सभी को हमारा सादर प्रणाम, सुप्रभात, good morning. Most Honorable Union Minister of Fisheries, Animal Husbandry and Dairying, Shri Parshottam Rupala ji. Most respected Union Minister of States, Shri Murugan ji. Our Principal Scientific Advisor, Professor AHSSOH ji. DG Health Service, Dr. Atul Goyal ji. Of the dais, our former Secretary, Shri Atul Chaturvedi ji. From the World Bank, Oliver, Dr. Rahman from ILRI, Dr. R.H. Orphan from WHO, Minesh Saji from NDDB, Sanjay Shukla ji from CZA, former ASC Praveen Malik ji, my friend and colleague Dr. Ropi Chaudhary, all the dignitaries, ladies and gentlemen, press and media. It's a very proud privilege and honor to welcome you all on the behalf of the ministry, as well as from all those millions farmers and livestock rearer of this country. Today is a very great day. Let me start putting my tribute to none other than the father of our constitutional writer, whose birthday today, Shri Ambedkar ji. And this is also a very auspicious day because many part of the country we are celebrating the end of Chaitra Mahina and starting a new Mahina, new month of Baishakh. So all of you to Happy Baishakhi, Meshadi, Tamil Happy New Year. I said I could not get the term correct. And Poila Boishakh from Bengal and so on. So again, welcome to you to all. Sir, to make it very brief and crisp, India has the only land of 2.4% of the whole world. We share only 4% of the water resources. But we possess nearly 11% of the human population, nearly 16% of the livestock, and 18% of the total poultry of the world. And we have a border of nearly 15,200 kilometers, which are nearly porous, which states that we as a country, if we do not do well, our world, human health, environmental health, and the earth health is not going to do good. So with the inspiration from our Honorable Minister, Shri Rupala ji, today we are going to have two programs. One, we understood from our pandemic, last pandemic, which we covered, and many of us also still suffering, cases are rising, that it is so very important to have a preparedness. So first time in the world of this kind, the ministry is coming out with an initiative which called Animal Pandemic Preparedness Initiative, to keep ourselves ready for any future pandemic. And it is well said, pandemics will come and go. We cannot stop them. But if we can delay them or control them in a better way, that is optional and choice lives with us. And when I say that, I must mention the role of our PSA, sir, Susab, as well as our former Secretary Atul Chaturvedi ji and our present Secretary Rajesh ji, to particularly to conceptualize and bring this APPI in this form. And also we are going to have, from the World Bank supported, a project which we have recently negotiated. We are waiting for the formal approval of the World Bank. These two programs is going to come. not taking much time before you and the honorable speakers and all the dignitaries. After this program, we are going to have a small world cafe to interact with all the cross-sectoral people to understand, realize, appreciate, and assimilate that how, as a different actor, we can play this bigger drama or a bigger picture so that we will be successful and we can protect ourselves to, as well as the livestock, to have a healthier livestock and wealthier nation. With this, I welcome you, each one of you, to again welcome, and in spite of holiday, it shows that your love and affection for the livestock farmers and livestock and poultry. I welcome you, each one of you again. Jai Hind, Jai Bharat, Namaskar.
Thank you very much, sir. To set the tone and context for the day, please welcome on the dais Shri Rajesh Kumar Singh, Secretary DAHD. Can we all please welcome on the dais?
Good morning, everybody. Namaskar. भारत के पशुपालन, मत्स्य पालन, पशुपालन और डेयरी मंत्री श्री परम आदरणीय श्री परशोत्तम रुपाला जी, भारत के पशुपालन, डेयरिंग, फिशरीज और इंफॉर्मेशन एंड ब्रॉडकास्टिंग के राज्य मंत्री श्री लोकनाथन मुरुगन जी, Professor Dr. Atul Goyal, Director General of Health Services, Professor Ajay Kumar Sood, Principal Scientific Advisor to the Government of India, my colleagues here, Dr. O.P. Chaudhary and Dr. Abhijit Mitra, my respected predecessor in Department of Animal Husbandry and Dairying, Mr. Atul Chaturvedi, other colleagues from NDDB, from the state governments, from our own department, from the press and the media, ladies and gentlemen. I won't take too much time, and I won't repeat what has been mentioned already by Dr. Mitra. One Health is a subject that has been, a term that has been around for some time, but by its very nature, it is interdisciplinary, it is interdepartmental, it involves coordination among different institutions, agencies of government, and often we find that while coordination at the top end is feasible, at the cutting edge level, often the coordination tends to be missing. And those are the gaps that we are trying to fill through this initiative. I, in fact, wanted to also particularly congratulate and thank the Principal Scientific Advisor's Office for taking the lead in bringing together these three verticals that are involved in this sector: the wildlife sector, where one department is involved; the human health sector, where at least 2 departments of government and myriad other institutions are involved; the Department of Animal Husbandry itself, which deals with livestock health; and of course, agencies like the Department of Agriculture, Research and Education, which also have a bunch of research institutions doing similar work on animal husbandry and livestock diseases. As all of you are aware, India is among the highest risk regions for animal disease outbreaks because of its very high density livestock population, extensive animal-human interface, and porous boundaries with our neighboring countries. And as a result, we've recently had a pretty tough time, not only with human pandemic, which of course has not quite faded away, which is still showing signs of increasing caseload again, but also in the area of animal health or livestock health, where we've just had a very bad set of losses due to the lumpy skin disease, also ongoing outbreaks at the regional level of avian influenza, as well as of the Asian swine flu. Now, it is in that context that the Department of Animal Husbandry and Dairying thought that we should launch an initiative which brings together the different agencies involved in the sector, particularly the cutting edge level at the state government level, so that we are prepared for, better prepared for handling outbreaks, and also better prepared for mitigating, responding, and if required, creating the vaccine response as well as the other medical response to handle such outbreaks. Along with this, it is fortuitous that we also have a World Bank project that we are ready for a soft launch today, which is awaiting board approval, which is going to cover 5 of our most high-risk states which have the potential of livestock-related disease outbreaks. Our colleagues from those state governments are here today, and I welcome all of them to this interaction so that we can prepare ourselves better for this project to start moving quickly once the board approval and the loan effectiveness comes into place, so that we are all set to hit the ground running from day one. The World Bank project in particular, I wanted to mention, has a very concrete set of deliverables. We want to ensure upgradation of 75 district and regional labs in the country, of 300 veterinary facilities across these districts, of training 9,000 paravets and 550 veterinary professionals in dealing with pandemic response. As part of the Animal Pandemic Preparedness Initiative, our focus is on the following key elements: improved surveillance and monitoring and early warning and response, coordination at the ecosystem level from various stockholders, building upon the National Digital Livestock Mission, which will provide the data and which will help us monitor and respond to disease outbreaks faster. Now, on the National Digital Livestock Mission, I wanted to say that just a couple of days back, the app has gone live in Uttarakhand. The pilot project is now statewide in Uttarakhand. Data is already flowing in from labs, from veterinary surgeons, from farmers, and in particular, the medical data which will come in real time in future across the country will give us an ability to respond to get data and respond more quickly to any animal disease outbreaks. And that brings me to the other elements of this APPI initiative, which is vaccine development and R&D, building better disaster resilience in coordination with the National Disaster Management Authority, and also mobilizing resources and funds from multilateral agencies like the World Bank, but also we are trying to tap the Global Pandemic Fund as well as perhaps the Asian Development Bank in the near future. Also, we've tried to ensure that our regulatory framework for clearances to vaccines and various types of veterinary medicines is speeded up. We are just about to launch an online regulatory system for ensuring that a transparent and quick clearance mechanism is put in place for vaccines and other veterinary medicines. So with these words, this is broadly the context, ladies and gentlemen. Thank you for joining us, and we look forward to engaging with you in the future in taking this initiative forward the way it should in the interest of our livestock farmers. Thank you.
Thank you very much, sir. I now take the opportunity to invite on the dais Professor Dr. Atul Goyal, Director General of Health Services, Ministry of Health and Family Welfare, to share his thoughts with us. Please welcome him.
Thank you for having me here. Honorable ministers on the dais, other dignitaries on the dais, dignitaries of the dais, colleagues and friends. Well, I am perhaps an odd man out that I'm looking after human health, but we have a common thread. We've all been students of science. Now, for that matter, is One Health a new concept? I believe it's a old wine being served in a new bottle. We've all learnt about ecosystems. Ecosystems are not about human beings. Ecosystems were about everything around us, which included the plants, the animals, the environment. That's one thing which is still perhaps left out of the the One Health concept. So we were always in an ecosystem. Perhaps human beings became isolated to think only about themselves. I am glad the thinking has come back to the fact that we need to cooperate together in various fields to get together and then realize about the health of the nation or health of the human being. Zoonosis is not something new. You see, zoonosis, perhaps, you know, it's centuries old. The first zoonotic disease was perhaps malaria, which came from monkeys in the jungles to human beings when the human and the animal interaction started for the first time. So I'm glad the wheel has turned a circle and we realize that we are perhaps the biggest reason why zoonosis is happening or more and more diseases are happening. And as the environment becomes warmer, as we go into the so-called global heating, these zoonosis and these diseases are going to be on the rise. In fact, fungal infections are on the rise, perhaps because of increase in the temperature as well as the atmospheric water vapor because of the increased population around the world. The resources around the world are limited. as the population increases, the interaction between the human beings and animals and the forests and the plants would also increase. So we really need to take care, and I'll be glad to cooperate with the Department of Animal Husbandry to a lot of things, you know, including eradication of rabies from the country. I'll keep it here short and sweet. Thank you.
Thank you very much, sir, for your insightful address. Ladies and gentlemen, we now request all of you to please direct your attention towards the screen as we'll now play a video message by Dr. H. Kugita, Regional Representative, Asia and the Pacific, World Organization for Animal Health. Let's take a look.
His Excellency Shri Parshottam Rupala, Honorable Minister, Ministry of Fisheries, Animal Husbandry and Dairying, Shri Rajesh Kumar Singh, Secretary, Boa Delegate of India, distinguished participants, good morning. My name is Hirofumi Kugita, Boa Regional Representative for Asia and Pacific. Firstly, I would like to thank the organizer for the invitation extended to the World Organization for Animal Health. It is indeed very encouraging to note that the Department of Animal Husbandry and Dairying, Government of India, has embarked upon its National One Health mission with a focus on strengthening animal pandemic preparedness through diverse activities, including an integrated disease surveillance system. I am also delighted that DAHD will launch a collaborative project with the World Bank to create an ecosystem for better animal health management using the One Health approach at various levels. At WOA, we are very much aware of the burden of animal diseases globally. 1.3 billion people depend on food animals for their livelihood. We therefore believe that it is essential for countries to have efficient veterinary services to provide timely animal health services, including preparedness and response to animal disease epidemics and pandemics. In this regard, WOA's flagship programs, the Performance of Veterinary Services, or PVS pathway, provides support to countries in assessing their capacity and gaps in delivering quality animal health services. India conducted its previous evaluation mission in 2019. Your engagement with animal pandemic preparedness initiatives is well timed. About 60% of existing human infectious diseases are zoonotic. WOA strongly advocate controlling zoonotic pathogens at their animal source. This is the most effective and economic way of protecting human health using the concept of One Health. At the global and regional level, WOA works closely with its quadripartite partners in supporting our members to build systems and capacities to address zoonosis such as rabies, avian influenza, and other health threats such as antimicrobial resistance or food safety. The World Bank funded Animal Health Support System for One Health program being launched in India is very much in line with our concept of tackling health risks jointly involving key stakeholders from human, animal, plant, environment, and wildlife health sectors. This positive step taken by India can have huge benefit to your country and also to the region. And therefore, I am happy to be part of this noble initiatives from the government of India. This will have far-reaching consequences in enhancing animal disease control, including zoonosis, and the promotion of One Health initiatives in India and in the region. We at WOA are at your disposal should India need any support or collaborations. I wish you all a successful launching ceremony for the two big initiatives as part of the National One Health mission in India. Thank you very much for your kind attention.
Thank you, Dr. Kulgita, for joining us virtually. I now request and invite Dr. Roderico H. Offrin, WHO representative to India, to share his thoughts with us. Can you please welcome him?
Thank you. Shri, Parshottam, Rupala, Honorable Minister of Fisheries, Animal Husbandry and Dairying, Dr. L. Murugan, Honorable Minister of State of Fisheries, Animal Husbandry and Dairying, Professor Ajay Kumar Sood, Principal Scientific Advisor to the Government of India, Shri Rajesh Kumar Singh, Secretary, DAHD, Professor Atul Goel, Director General Health Services, Dr. Abhijit Mitra, Animal Husbandry Commissioner, Dr. O.P. Chaudhary, Joint Secretary, dignitaries of the dais virtually, and participants, friends. Namaskar. Thank you very much for this invitation. I'm very happy to be here to really revitalize what is needed for the One Health approach. These discussions and these launches are so important for us if we want to move to a world that is pandemic-free. Recent international health emergencies, COVID-19 pandemic, which we're still managing, living with, monkeypox, Ebola outbreak in West Africa, subsequently in DRC, Nipah outbreaks in India, to name a few, and the continued threats of other zoonotic diseases, food safety outbreaks, antimicrobial resistance challenges, ecosystem degradation, and climate change clearly demonstrate the need for a One Health approach for building a resilient future and accelerated global action to save humanity. As Dr. Atul Goel was saying, it's the imbalance of our ecosystems are caused by us. I think the solutions should come from the humanity itself, and that requires us to work together. The threat of future pandemics from diseases of animal origins is serious because we have encroached in the natural environments of animals. We need a robust system for early detection of acute public health events, especially the spillover events, meaning diseases from animals move to humans. This makes disease surveillance among animals, especially wild animals, and generating early warning alerts very critical. The One Health approach is imperative for the effective prevention of zoonotic-related pandemics and outbreaks. India has championed the need for One Health at the highest fora, including the ongoing discussions of the G20 dialogues. Recent investments in health through the PM Abhim and Ayushman Bharat, and of course, the initiatives that will be launched today show us that India is well poised to lead the world around operationalizing the One Health approach. While we appreciate the richness that India has in terms of livestock resources, meat, milk production, we need to be vigilant about the threat of certain infectious diseases that are transmitted from animals to humans and among animals. The quadripartite organizations, namely Food Agricultural Organization, United Nations Environment Program, WHO, and the World Organization for Animal Health, have been playing a central role in promoting and coordinating a global One Health approach. This is in line with the objective of the One Health Joint Action Plan to create a world better able to prevent, predict, detect, and respond to serious health threats and to improve the health of humans, animals, plants, and the environment, while contributing to sustainable development. The Animal Husbandry Department has taken laudable steps towards this goal, and now we are taking concerted actions across all partners to implement One Health action at subnational levels. the collective commitment and efforts of central and state governments with support of all stakeholders. There are many partners also working in this for intersectoral coordination will help further strengthen animal health surveillance systems to fully understand the emerging epidemiology of the zoonotic infections, AMR, climate change and its impacts, and other pressing issues affecting the health of all species. WHO stands committed to providing technical support for further strengthening the One Health approach in India through close collaboration with the animal husbandry sector and the Ministry of Health and Family Welfare and other line ministries and agencies. It's time to have the One Health approach linking together and really speaking to each other as opposed to our each sector having its own One Health initiatives. My best wishes to the successful deliberations of the workshop and congratulations on the launch of these initiatives. Thank you very much.
Thank you very much, sir, for your thought-provoking address. Ladies and gentlemen, we once again request you to please direct your attention towards the screen as we'll now play a video message by Dr. Scott Newman, Senior Animal Health and Production Officer, Food and Agricultural Organization.
Good morning. Dr. Abhijit Mitra, Animal Husbandry Commissioner and Chief Veterinary Officer of the Government of India, dignitaries, ladies and gentlemen. It's an honor for me to be part of the launch of this ambitious and much-needed India initiative on animal pandemic preparedness. I'm confident that this initiative will enhance the national capacity to respond efficiently and effectively to emerging zoonoses, antimicrobial resistance, and pandemics which may hit the world in the immediate future. The COVID-19 pandemic has taught us many lessons. While the human health and global development need to be protected and preserved during pandemics, equally important is maintaining the health of working animals and animals that serve as a source of food and nutrition security. The pandemic reiterated the need for urgent, systemic, concrete, multi-sectoral actions to prevent, control, and respond to and mitigate the impacts of infections that have been and shall continue to arise from animals and spill into humans. The COVID-19 pandemic has also highlighted the close interdependent relationship people have with nature, and it's demonstrated that if we reduce the pressure on nature, it can bounce back and provide us with increased benefits and value. The reduction in travel and use of energy due to the lockdown resulted in significant decreases in air pollution and greenhouse gas emissions within just few weeks. It's known that about 75% of all new pathogens identified in people during the past 4 decades have originated from animals. Close and continuous cohabitation of humans and animals, environmental degradation, and risky human behaviors facilitate a conducive environment for spillover, emergence, and spread of novel pathogens. Some of these pathogens have already caused large-scale public health impacts, public health emergencies of international concern, as well as impacting food and nutrition security and affecting livelihoods. While WHO has declared 7 public health emergencies of international concern during this millennium, many more are expected in the near future. For this reason, India's initiative on animal pandemic preparedness is very timely and extremely important to serve as a robust firewall against future pandemics and to increase India's preparedness, prevention, and rapid response capacity. On behalf of FAO, I congratulate the Government of India for taking steps to improve pandemic preparedness, and I want to reiterate FAO's commitment to provide necessary technical assistance to enhance prevention, detection, and response capacity at national, regional, and state levels. As part of this program, FAO advocacy and technical support will be forthcoming to help implement One Health programs in selected states of India. And we look forward to identifying further opportunities to collaborate and improve pandemic preparedness. Once again, on behalf of FAO, we'd like to congratulate you on this very important initiative. Thank you, and we wish you a great, successful workshop.
Spot for joining us. With due respect, I now invite Mr. Oliver Bread, Head Agriculture and Food Global Practice, World Bank, to share his remarks with us. Let's all welcome him.
Good morning, Honorable Minister Rupala, Honorable Minister Murugan, Dr. Chaudhry, Professor Goel, Professor Kumar, Dr. Mitra, Shri Kumar Singh. I would also like to say hello to Mr. Shadurvedi, Mr. Basu, and Dr. Malik. It's really an honor to be here today to launch the Animal Pandemic Preparedness Initiative, but also the World Bank-funded Animal Health System Support for One Health project. We concluded the negotiation recently successfully, and I'm hoping that in the next weeks, early May, our board will approve it so that we can start the actual implementation of the operation. We, from the World Bank, welcome very much this close interaction with the various institutions that have been mentioned and that have spoken before me. Let me not maybe repeat too much what other speakers before me have said, and I know many of you here are subject matter specialists, so I would be preaching to the converted. But a couple of things maybe from where we stand, from where I stand, just to highlight. What we have learned from the pandemic and hasn't been mentioned is the severe economic impact. And that's one other reason why it's very important to really focus on the One Health aspects going forward. So both initiatives are really in the forefront of our attention where we want to focus on. The second one is also to stress, and it hasn't been said, that India has already been quite active on this topic. There was a big event already in 2007. There's been several institutions that have been created. And I must say also resources that have been allocated. Because one thing to make this happen is obviously it requires money at the end of the day, right? It requires, it was mentioned before me, the willingness of cooperate amongst these different institutions. We generally have more ability to source funds for human health. But I think it's important through these events and through these operations to draw their attention that the animal side and the wildlife side is important too. Because the overall gain to prevent or to be better prepared for a pandemic will be easier going forward if both angles are touched. Let me finish with a final statement. We also look at India very much as an example. Increasingly, in many topics, the regional neighbors, but also globally, are looking at India. And I'm really hoping, and that's one area why we really are paying attention to the One Health agenda, is that India will be, again, a lighthouse on this approach and an example for many other countries to come. So I really welcome today's event. I wish everyone fruitful discussions and obviously a success of this, and looking forward to working very closely with the government of India and all partner institutions going forward. Thank you.
Thank you, sir, for your words of wisdom. With all means of warm and friendly welcome, I have the pleasure to invite on the dais Professor Ajay Kumar Sood, Principal Scientific Advisor to the Government of India, to share his views and experience with us. Let's welcome him.
Honorable Ministers, Shri Rupala ji, Shri Murugan ji, other dignitaries on and off the dais, distinguished participants, ladies and gentlemen. It is indeed an honor for me to be present at the launch of Animal Pandemic Prepared Initiative. When I took over as Principal Scientific Advisor to the Government of India on April 25th last year, almost completing 1 year now, in my very first meeting with Dr. Sindura Ganpati, whom all of you, many of you will be knowing as he is leading this whole initiative for the last 1 year, I emphasized that we need to take One Health mission in a focused manner. Now, the overall concept of One Health mission was presented to Prime Minister's Science, Technology and Innovation Advisory Council last year meeting, where the concept of APPI was also presented by Atul Chaturvedi ji's former secretary, and there was a complete wholehearted endorsement of this idea by PM Staik, and we were encouraged to take it forward, and I had briefed this to Honorable Prime Minister, and we formed a steering committee that I have been chairing with all the secretaries and DGs of more than 10 departments comprising of all science funding agencies, human health, livestock, wildlife sector, disaster management and defense. So this is really an exercise in collaborating across the board in a manner which benefits all the sectors. So with APPI as the core component, the overall One Health mission has a very more comprehensive approach, which is, I believe, is one of the good initiative in the world. And in the most recent steering committee we had, it was decided to take One Health mission to the cabinet for the approval. So it is really in the works, and we are sure it will go a long way in serving not only India but the whole humanity. I would like to congratulate Department of Animal Husbandry and Dairying for taking up APPI in a focused manner without delay. And for the last 2 years, our office, Principal Scientific Advisor Office, has partnered closely with the DAHD in a wide ranging of things, from improving breeding programs through introduction of genomics, addressing the issue of foot and mouth disease, vaccine issues, building a robust regulatory system for animal vaccines and other products under the Empowered Committee for Animal Health, among many others. So one of the most significant programs that my office has been involved with DAHD is the National Digital Livestock Mission, NDLM. From the very concept and design of the idea, funding the technical support, bringing the right groups together such as iSpirit, startups together and so on. So it makes me extremely happy on this occasion when I hear that such a unique and transformative program of national importance has been coming along well with the cooperation of all the stakeholders in a seamless manner, and it is about to be rolled out. You will all agree that NDLM, National Digital Livestock Mission, which was mentioned by Rajesh Singh ji, it's already there, and the data, 90% of the data is already on board from many states, and this really will go a long way in contributing towards animal pandemic preparedness. Now, needless to say, PSA office will be very happy to support this sector in any manner we can, because we are the integrators, and the performance and the implementation is done by all the science departments and the ministries. We only facilitate and catalyze things, and I'm sure we will have great success as we go along. You will all agree that this is not only for India, as was mentioned repeatedly, it is of importance to the entire world. And I'm glad that G20 initiative, under G20, we have taken this up. Few days back, there is a new vertical, government vertical, which has been added to G20, Chief Science Advisor Roundtable of 20 countries, which met recently in Uttarakhand, and One Health Mission was an agenda on that, and glad to share that it had unanimous support to work together at the policy level in the government. As I said, Chief Science Advisor's role is that in the government, and we hope that we can put all the actions in a manner that it happens. So I would like to again congratulate all the stakeholders today for launching this APPI and the World Bank supported animal health support system for One Health. And I'm sure with the participation from all of us for the public good, we will go a long way. Thank you very much and all the best.
Thank you very much, sir. We are indeed grateful for your time and your expertise. With due respect, I now invite on the dais Dr. Loganathan Muruganji, Honorable Minister of State of Fisheries, Animal Husbandry and Dairying, to share his thoughts with us. Can we welcome him with a thunderous round of applause?
Honorable Minister for Fisheries, Animal Husbandry and Dairying, Government of India, respected Shri Parshottam Rupala ji, Principal Scientific Advisor to Government of India, Professor Ajay Kumar Sood ji, Secretary Animal Husbandry and Dairying, Shri Rajesh Kumar Singh ji, DG Health Services, Professor Atul Goyal ji, Mr. Oliver Brett from World Bank, Dr. O.P. Chowdhury, Joint Secretary, Department of Animal Husbandry, Mr. Abhijit Mitra, Commissioner Animal Husbandry, Dr. Roberto Ofren, representative from WHO, Shri Atul Satirvedi ji, former Secretary, Government of India, Minesa ji from NDDB, and senior officers from the department, dignitaries, ladies and gentlemen, friends from media, namaste, vanakkam to you all. It is indeed a happy moment today. We are launching the Animal Pandemic Preparedness Initiative, APPI, and World Bank supported Animal Health System support for One Health. Today is the Tamil New Year, that is Puttandu, and Bharat Ratna Dr. Babasaheb Ambedkar birth anniversary. I extend my greetings to you all of you. Dr. Ambedkar worked for the mission of achieving one social health. On his birth anniversary, we are launching this initiative on the occasion of Tamil New Year. I congratulate all of you on this momentous occasion. Friends, nature is interconnected. Although we human beings do differentiate between animal health, human health and environmental health, the nature does not recognize these boundaries. And that is why we must take forward this philosophy of one health in all endeavors. As one of the biggest producers of marine product, as the second biggest producer of aquaculture and biggest exporter of shrimp products, India playing a significant role in world fisheries scenario. Same is in the case with our dairy and animal husbandry products too. Our sustainable development for this sector and for sustainable welfare of the fishermen and animal husbandry and dairying entrepreneurs, the focus on animal health become crucial. Recently at Chennai, our department launched a similar initiative on fish disease and associated health matters. We all know our visionary leader, our Prime Minister Shri Narendra Modi ji's concern for this sector for animal health. We had committed to initiate animal health at our doorstep. Today, more than 4,000 mobile veterinary units, animal ambulances with the cost of more than 650 crore has been sanctioned just at a phone call. The well-equipped mobile veterinary unit come to the doorstep to address the animal health issues to the farmer's house. Under the dynamic leader, our Prime Minister Shri Narendra Modi ji, and the direction of our Minister Shri Parshottam Rupala ji, the animal husbandry, dairies and fishery sector is showing remarkable results. Today's initiative is a big step in this direction. I wish all those associated with this program all the best. Thank you. Jai Hind, Jai Bharat.
Thank you very much, sir. We feel privileged to have had the opportunity to hear from you today. Ladies and gentlemen, the much awaited moment has arrived. We will now launch the Animal Pandemic Preparedness Initiatives and Animal Health Support for One Health program. Today we are honored to have our chief guest, Honorable Minister Shri Parshottam Rupala ji, to launch these programs by pressing the video button.
Agriculture and its allied sectors have always been central to India's growth and development. The contribution of the livestock sector has been immense and significant both for the Indian as well as the global economy. More than 280 million Indian farmers derive their livelihood from livestock. This means that a disease outbreak among livestock can completely disrupt their lives. The mixing of humans, livestock and wildlife populations, along with the changing climate, is increasing the frequency of disease outbreaks and cross-compartmental disease spread. 2/3 of all human infectious diseases such as rabies, Nipah, anthrax, bird flu, swine flu, and SARS originate from animals. The outbreak of zoonotic diseases has been on the rise, which has also led to an increasing impact on human lives and livelihoods. The dependency of humans and animals on each other has created a close connection between our lives, our well-being, and even our health. We breathe the same air, we drink the same water, we eat food that comes from the same soil. This close connection also makes us vulnerable to being affected by each other. The National One Health mission is being developed to prioritize the protection of animal and human health to improve lives and livelihoods in India. The mission will focus on these 4 areas, facilitated by the partnership and collaboration of several government departments. Preparedness for health and pandemics has focused on humans so far. There is a need to be prepared for animal diseases to achieve overall preparedness for One Health. The Department of Animal Husbandry and Dairying is taking this important initiative of addressing this need through the launch of a first-of-its-kind initiative in the world, the Animal Pandemic Preparedness Initiative. Under the leadership of Honorable Minister for Fisheries, Animal Husbandry and Dairying, Shri Parshottam Rupala, the Animal Pandemic Preparedness Initiative is being launched on April 14, 2023. The Animal Pandemic Preparedness Initiative will come into effect with large-scale surveillance of animal diseases, synergies from advances in human vaccine for animal vaccine development, institutionalizing disease modeling algorithms and targeted early response systems, ecosystem coordination, outbreak investigation and response, and building disaster resilience. Strengthening the regulatory framework and mobilization of funds and resources will be the key enablers for ensuring the effectiveness of this initiative. A seamless partnership between global organizations, Indian research institutes, and Indian pharma companies will ensure successful and timely vaccine development. The Animal Pandemic Preparedness Initiative will build a more resilient system to support the Government of India's vision of developing the national One Health platform by strengthening on-ground overall disease control capability so that our farmers have disease-free animals, consumers get quality foods, and India's exports strengthen. This initiative can not only help India, but the world in preparedness towards animal diseases and building a healthier future for all.
A large the Indian population relies on farming and are in close contact with domestic animals and poultry. High exposure between livestock, people and wildlife poses a risk of disease outbreaks. During the COVID-19 pandemic, the need to build better capacity to prevent, detect and control zoonotic diseases was identified. The ongoing schemes of DAHD has achieved results when it comes to expansion of vaccination program, strengthening regional disease diagnostic laboratories, making provision for mobile veterinary units in states and union territories. But key challenges of institutional strengthening remain. Recognizing the challenges, Department of Animal Husbandry and Dairying DAHD, Government of India took initiatives through the One Health approach and by establishing the One Health Support Unit. The One Health pilot showcased that the core capacity for animal health management in India needs strengthening. These learnings are being integrated to build a robust support system through the Animal Health System Support for One Health. Under the leadership of Honorable Minister for Fisheries, Animal Husbandry and Dairying, Shri Parshottam Rupala, the World Bank-funded Animal Health System Support for One Health is being launched on April 14, 2023. This collaborative project aims to create an ecosystem for a better animal health management system using the One Health approach. The project will be implemented in 5 states, 75 district laboratories, 100 MVUs, 300 dispensaries and hospitals, along with training of 5,500 veterinarians and 9,000 para-veterinarians, diagnostic professionals. It focuses on building institutional capacity, enhancing capacity of diagnostics, enhancing access to quality veterinary services, improved disease surveillance and monitoring, and community-level investments. Participation by the Ministry of Health and Family Welfare, Ministry of Fisheries, Animal Husbandry and Dairying, and Ministry of Environment, Forest and Climate Change at national, regional as well as local levels can create and strengthen the One Health infrastructure. These ministries will work in collaboration to support Government of India's vision of building a healthier future for all.
Thank you, Honorable Minister, for launching these important initiatives. Let's build a healthier future for all. Ladies and gentlemen, we are now pleased to announce the release of publication of One Health Support Unit by our chief guest, Honorable Minister Shri Parshottam Rupala ji. We'll be releasing 4 publications. The first one is on global learnings on One Health. With this, we release the global learnings on One Health. Thank you. Our next publication is Enhancing Food Safety Through. A round of applause. Our next publication is Anthrax Disease Status Report. With this, we release Anthrax Disease Status Report. And our last publication is KFD Disease Status Report. Thank you very much, dignitaries. The One Health Support Unit has been working tirelessly to gather and disseminate information on various diseases that affect both humans and animals. These publications contain the latest research, updates, and recommendations from our team of experts. Thank you so much for releasing the publications. Ladies and gentlemen, it is indeed an honor to invite on the dais our chief guest, Shri Parshottam Rupala ji, Honorable Minister of Fisheries, Animal Husbandry and Dairying, to enlighten us with his words of wisdom. आइए जोरदार तालियों से स्वागत करें माननीय श्री परशोत्तम रूपाला जी का।
नमस्कार, सभी को मेरा राम राम। बैसाखी, पुनांडु और बाबा साहेब आम्बेडकर जी की जन्म जयंती की आप सबको ढेर सारी शुभकामनाएं। इतने पवित्र त्योहारों के इस मंगल अवसर पर ये दोनों इनिशिएटिव को लॉन्च करते हुए मुझे अपार खुशी, हर्ष और गौरव हो रहा है। मंच पर विराजमान मेरे साथी डॉक्टर मुरुगन जी, हमारे प्रिंसिपल साइंटिस्ट एडवाइज़र आदरणीय सूद साहब, हमारे हेल्थ डिपार्टमेंट से पधारे हुए डीजी साहब, मैं हमारे सचिव महोदय राकेश कुमार सिंह जी, हमारे कमिश्नर श्री, हमारे पूर्व सचिव चतुर्वेदी जी, वर्ल्ड हेल्थ ऑर्गेनाइजेशंस के प्रतिनिधि, वर्ल्ड बैंक के प्रतिनिधि, FAO से जुड़े हुए टेक्नोलॉजी से हमारे जो विदेश से टेक्नोलॉजी के माध्यम से हमारे साथ जुड़े हैं, मिनेश जी, विभाग के वरिष्ठ अधिकारी, प्रेस मीडिया के साथियों, आज एक ऐसे इनिशिएटिव की ओर हमारे विभाग की ओर से इस घटना का साक्षी बनने का मुझे सौभाग्य मिला है। इसके लिए मैं मेरी प्रसन्नता जाहिर करता हूं और बड़ी हर्ष और खुशी व्यक्त करता हूं। प्रधानमंत्री श्री नरेंद्र मोदी जी ने प्रधानमंत्री बनने के बाद पशुपालन क्षेत्र के लिए दो बहुत बड़े इनिशिएटिव लॉन्च किए। उनमें से एक, जिसका जिक्र मुरुगन जी ने बताया था, वो मोबाइल वेटरनरी यूनिट, जिसके जरिए हम डोर स्टेप तक पशुपालकों को टेक्नोलॉजी की मदद दे सकते हैं। और सबसे बड़ा इनिशिएटिव लिया गया था वो था वैक्सीनेशन का, जो हमको ये पैंडेमिक के दौरान पूरी दुनिया में भारत को जो श्रेय मिला, अपने हेल्थ विभाग के अधिकारी महोदय उपस्थित है, इसके उपस्थिति में बताते हुए मैं फख्र महसूस कर रहा हूँ कि कोरोना वैक्सीन मैनेजमेंट में जिस प्रकार से हमारे देश को दुनिया में कोरोना मैनेजमेंट के लिए सराहा जाता है, ऐसा ही मैनेजमेंट एनिमल सेक्शन में लाने का प्रयास प्रधानमंत्री जी के द्वारा किया गया था और पूरे देश के पशुओं को वैक्सीनेट करने की एक योजना लॉन्च की गई थी। 13,000 करोड़ रुपए की मातबर राशि का आवंटन करते हुए इस योजना को लागू करने का प्रयास हुआ था। इन दो इनिशिएटिव के बाद अभी हम जिस पर चर्चा कर रहे हैं, अब पूरी दुनिया सजाग हो गई है कोरोना के बाद। वैसे हमारे हेल्थ से आए महोदय ने बताया था कि ये चक्र वहीं से ही फिर उधर आके रुका है, तो ये बात सही है। मगर हमें दो बिंदु पे मेरा मत है, विनम्र मेरा मत है कि हमें ख्याल करना होगा। एक तो हम सोच रहे हैं कि हमारा हेल्थ है वो सारी सृष्टि के हेल्थ के साथ जुड़ा हुआ है। ये बात भी सही है कि वो स्वस्थ नहीं रहेंगे और हम स्वस्थ रह जाएंगे, एक संकल्प अभी, ये कल्पना चलने वाली नहीं है। सो सभी का हेल्थ समूह में देखना होगा। इसी में से ये वन हेल्थ वाला कॉन्सेप्ट अब उभर कर सामने आया है। दूसरी चीज हमें ये भी सोचनी होगी कि पशुओं के हेल्थ पर हमारी और चीजें भी निर्भर हैं। उनके हेल्थ खराब होने से हमें मिल्क प्रोडक्शन भी कम मिलेगा, उनके हेल्थ बिगड़ने से हमारा मीट, एग, मिल्क, ये तीनों पर हम डिपेंड हैं, वो हमारे पे डिपेंड नहीं है। हमको खाने वाले प्राणी नहीं है। इसका विनम्रता से हमें सबको इनका स्वीकार करना चाहिएगा, हम इन पर निर्भर हैं। सो फूड सिक्योरिटी के लिए भी उनके हेल्थ का सुरक्षा करना ये हमारे लिए कंसर्न है हमारा, उस पर हमें गौर करना पड़ेगा। वो तंदुरुस्त रहेंगे तभी आप दूध पिएंगे, तभी आप एग खाएंगे, तभी आप मीट खाएंगे। सो ये फूड सिक्योरिटी के लिए भी उसी के स्वास्थ्य के ऊपर हमें चिंता करनी चाहिए। और मुझे बड़ी खुशी है कि ये एपी करके जो हम आज एक नया इनिशिएटिव लॉन्च कर रहे हैं, एनिमल पैंडेमिक प्रिपेयर्डनेस इनिशिएटिव, उसमें से मैं तो सिर्फ एक पी पर ही जोर देना चाहता हूँ। दूसरा पी जो है वो प्रिपेयर्डनेस वाला पी है, उसी पर हमें तैयारी करनी होगी। हमारे संसाधनों को हमें स्टॉक लेना होगा, हम हैं कहाँ और अभी आगे हमें कहाँ कैसे तैयारी करनी होगी। हमारे जो ट्रेनिंग करके हमारे संसाधन जो है, मानवीय संसाधन जो है, हमारी जो फैकल्टीज है, उनको भी हमें तैयार करना होगा। किस प्रकार से उनकी स्ट्रेंथ हम बढ़ाएं, उनके लिए हम कैसे प्रिपेयर हो। और पूरे देश को और दुनिया को इस इनिशिएटिव के माध्यम से हमारे प्रधानमंत्री जी ने कई चीज़ों में दुनिया को दिशा देने का प्रयास किया है। मैं मानता हूं कि इस क्षेत्र में भी दुनिया को दिशा देने का नेतृत्व प्रधानमंत्री जी के नेतृत्व में भारत करेगा। क्योंकि ये वर्ल्ड बैंक की ओर से और WHO की ओर से जो कमेंट आए थे, मुझे बड़ी खुशी हो रही थी कि भारत की ओर लोगों की नज़र है, भारत की ओर देखने का दुनिया का जो रवैया है वो अब बदल चुका है। और इसी सिनारियों में ये इस प्रकार का प्रिपेयर्डनेस होना और इसके लिए अर्ली डिटेक्शन हो, सर्वेलेंस हो, क्विक रिस्पॉन्स हो और फिर मैनेजमेंट हो, उन सारी प्रक्रियाओं को हम कैसे सुचारू रूप से संचालित कर सके, इसके लिए विभाग ने जिस प्रकार से कार्यक्रम को आरंभ किया है, मैं विभाग के अधिकारियों को भी बधाई देता हूं। और हमारे PMO की ओर से, साइंटिफिक एडवाइजरी ऑफिस की ओर से भी इसमें नियमित रूप से हमको मार्गदर्शन देना, हमको प्रोत्साहित करना और दिशा निर्देश देते हुए इसको कामयाबी की ओर ले जाने का जो सहयोग मिला है, इसके लिए भी मैं सूद साहब को बधाई भी देना चाहूँगा और धन्यवाद भी करना चाहूँगा। हमारे प्रधानमंत्री जी की बहुत ही स्पष्ट कल्पना है कि देश स्वस्थ होना चाहिए, तंदुरुस्त होना चाहिए। हमारा सौभाग्य है कि WHO के माध्यम से आयुर्वेद का सेंटर भी भारत को मिला और हमारे जामनगर को मिला, वो भी एक प्रकार से इसी दिशा का ही एक इनिशिएटिव है, इसी दिशा में ही आगे बढ़ने का एक माइलस्टोन मैं तो कहूँगा, क्योंकि हमारे एनिमल सेक्टर में भी ऑल्टरनेटिव मेडिसिन का भी प्रयोग बढ़ाने की आवश्यकता भी है और ज़रूरत भी है। इन सारी चीज़ों को इसके साथ एपी के साथ जोड़ भी सकते हैं हम, इसमें भी इनका किस प्रकार से हम प्रयोग बढ़ा सकते हैं, क्योंकि हमारे रूरल सेक्टर्स में, इंटीरियर एरियाज में ये ऑल्टरनेटिव मेडिसिन और आयुर्वेद मेडिसिन का भी प्रयोग और भी जो भी हो सकती है, इस सारी चीज़ों का प्रयोग हम कैसे कर सकते हैं और इसके जरिए हमारे एनिमल के स्वास्थ्य को, हमारे आसपास के समूह के स्वास्थ्य को हम कैसे ठीक कर सकते हैं, उसी दिशा में इन दोनों के माध्यम से हम आगे बढ़ेंगे। वर्ल्ड बैंक की ओर से जो हमें इस प्रोजेक्ट के लिए सहायता मिली है, इसके लिए भी मैं वर्ल्ड बैंक को भी धन्यवाद देना चाहूँगा, उसको बधाई भी देना चाहता हूँ कि इन्होंने इस प्रोजेक्ट को मदद भी किया है और आगे भी उसकी ओर से हमें इस प्रकार की मदद मिलती रहेगी। इस प्रकार के प्रोजेक्ट में जैसे कि हमारे पूरे देश के इंस्टीट्यूट को हम इसके लिए स्ट्रेंथन कर रहे हैं, इंटरनेशनल लेवल पर हमारा लेबोरेटरी का स्टेटस हो, हमारे चेकअप करने वाले इंस्टीट्यूट का लेवल हो, उसी को बढ़ाने के लिए, उसको स्ट्रेंथन करने के लिए भी हम इस एशोज के माध्यम से हम प्रयास करेंगे और करना चाहिए, ये ज़रूरी भी था। बहुत ही टाइमली मैं तो कहूँगा कि ये स्टेप्स हमारे डिपार्टमेंट की ओर से आया है। चतुर्वेदी जी ने जब प्रेजेंटेशन पहली बार किया था तब ये वन हेल्थ अभी इतना कॉन्क्रीट नहीं हो रहा था, मगर उसी अच्छी शुरुआत की वजह होती है, कुछ बीज अच्छे जब हम बो देते हैं तो इनके पेड़ भी अच्छे निकलते हैं। होनहार बिरवान के बहुत चिकने पात, जो छोड़ बड़ा होने वाला है उसके पत्ते बहुत ही चिकने होते हैं, ऐसा ही ये बीज बोया गया और अभी इसके फल हम भुगतने की तैयारी कर रहे हैं। आज इसी अवसर पर विभाग ने जिस प्रकार से इनको सक्रियता से समय पे इसको तैयार करके लॉन्च करने तक पहुंचा दिया, इसके लिए इनमें जिन जिन अधिकारी कर्मचारियों ने सहयोग दिया होगा उसकी भी मैं खुल के प्रशंसा कर रहा हूं। एक ऐसा इनिशिएटिव है, ये आज इनकी कल से कोई बड़ी वो नहीं होने वाली है, मगर अगले दिनों में इतिहास में ये ऐसी घटना लिखी जाने वाली है कि भारत ने लिया हुआ इनिशिएटिव पूरी दुनिया में एक इस प्रकार के सार्वत्रिक समावेशिक हेल्थ को प्रमोट करने की दिशा का ये नींव होगा। ऐसे कार्यक्रम को आज बैसाखी के दिन, हमारे तमिल नववर्ष के दिन और बाबा साहेब आम्बेडकर जी के, किसी ने बहुत अच्छा कहा कि उन्होंने सोशल हेल्थ के लिए बाबा साहब ने काम किया था, तो ये पूरे हेल्थ का कॉन्सेप्ट का बीज भी इसके बीच में आता ही है। ऐसे महापुरुषों की पावन स्मृति के साथ जब हम ऐसी एक कार्य का प्रारंभ करते हैं तभी उनके आशीर्वाद भी हमको प्राप्त होने का हमें लाभ मिलता है। ऐसी शुभकामना के साथ सभी जो भी स्टेक होल्डर्स यहाँ आए, खास करके WHO, वर्ल्ड बैंक और FAO के साथियों को, सभी का मैं स्वागत भी करता हूँ, सभी का धन्यवाद भी करता हूँ और प्रेस और मीडिया के साथियों को एक विनती करता हूँ कि भारत के इस इनिशिएटिव को आप इस प्रकार से अवेयरनेस के एक कार्यक्रम को दुनिया में इसको मैसेज के रूप में आप प्रसारित करेंगे, ऐसी एक अपील के साथ पुनश्च आप सबको ढेर सारी शुभकामनाएं, बहुत बहुत बधाई।
धन्यवाद माननीय, आपके प्रेरणात्मक शब्दों के लिए, आपके मार्गदर्शन के लिए आपका हार्दिक धन्यवाद। Ladies and gentlemen, it is a tradition at the DAHD to honor its distinguished guest with a token of respect, a token of gratitude. I now request Shri Rajesh Kumar Singh, Secretary, Department of Animal Husbandry and Dairying, to present a token of gratitude to our chief guest, Shri Parshottam Rupala ji, Honorable Minister, Fisheries, Animal Husbandry and Dairying. A round of applause, ladies and gentlemen. धन्यवाद माननीय आपकी गरिमामयी उपस्थिति के लिए, आपके निरंतर योगदान के लिए हार्दिक धन्यवाद. I now request Dr. Abhijit Mitra, Animal Husbandry Commissioner, Department of Animal Husbandry and Dairying, to present a token of gratitude to our special guest, Dr. Loganathan Muruganji, Honorable Minister of State of Fisheries, Animal Husbandry and Dairying. Thank you, sir, for your indefatigable support. Thank you very much. I request Dr. O.P. Chaudhary ji, Joint Secretary, Department of Animal Husbandry, to present a token of gratitude to Professor Ajay Kumar Sood, Principal Scientific Advisor to the Government of India. I once again request Dr. Chaudhary to present a token of respect to Professor Dr. Atul Goyal, Director General of Health Services, Ministry of Health and Family Welfare. Thank you very much. We once again thank all our esteemed dignitaries on the dais for their immense contribution to today's event. I now request Dr. O.P. Chaudhary, Joint Secretary, DAHD, to propose vote of thanks.
I take this opportunity on behalf of the Department of Animal Husbandry and Dairy to thank Honorable Cabinet Minister, Ministry of Fisheries, Animal Husbandry and Dairy to preside over this function today and to accept our invitation to be the chief guest. So we are grateful, sir, and we are very inspired by your presence. I am also very grateful on behalf of the department to our special guest, MOS Murugan Saab, to be part of this event. I am grateful for all the dignitaries on the dais and off the dais for taking their time and to be part of this event today. Representatives of World Bank, FAO, WHO, their presence is very encouraging today, and I want to thank you all. Messages, video messages from the World Organization of Animal Health and FAO were very encouraging, and on behalf of the department, I want to thank those representatives for those messages also. Friends from the state governments, our colleagues from the state governments who made it all the way to be part of this event today, I want to thank them. Friends and colleagues from the department, friends from research and academic organizations who are present here, I want to thank them all for this afternoon, for this morning today to be part of this event. And very important, the friends from other sectors, sister organizations, related sectors, they are partnering in the process. They are all worthy of thankfulness, and I want to thank them all on behalf of the department. And the friends from the private sector also, they are partnering with us in this effort. I want to thank them from my heart. And all the participants, friends from media, I want to thank you all, and the department is very, very grateful that you are part of this event today, you are with us. Thank you all, thank you very much.
Thank you very much, sir. We now request all of you to kindly assemble outside the hall for a group photograph with the distinguished dignitaries. At the plaza steps for a group photograph, followed by tea and coffee, and we will start the first panel discussion at 12 noon. Kindly assemble for the group photograph. Ladies and gentlemen, kindly proceed outside the hall. For tea and coffee, kindly proceed outside the hall. Thank you. Ladies and gentlemen, we are about to start with the panel discussion. We request all of you to kindly come inside the hall and please be seated. In case your colleagues are outside, you may give them a call and request them to join you inside the hall as we are starting with the panel discussion. We once again request all of you to please come inside the hall and take your seats as we are starting with the panel discussion. Welcome back, ladies and gentlemen. After a rejuvenating tea break, let's kickstart the panel discussion on the theme Institutionalization of Animal Pandemic Preparedness. I now invite Animal Husbandry Commissioner Dr. Abhijit Mitra to kindly initiate the proceedings.
Very good afternoon to all of you. All my professional friends, dignitaries, ladies and gentlemen, I am having with us our Secretary, Dr. Mr. Rajesh Singh ji also. OP Chaudhary, our JS, is also sitting here. So that makes very much important that people are interested to listen and discuss that how this APPI, what we have launched today, how we are going to make it institutionalized and implement in future. Just to set the tone and remind to all of you that if you have gone through the video, you have seen that there are 8 verticals which we talked about in APPI. One of the first vertical is disease surveillance and monitoring. I think all of you sitting in this hall will agree with me that until unless we do surveillance, including genomic surveillance and environmental surveillance, include all those sentinel sites, and we do both active and passive surveillance together, this initiative is not going to take off. Next vertical is creating a disaster modeling, disease modeling, and so that we have an early warning response. And of course, outbreak investigation and quick response team at the center, state, as well as the district level is very much important. And we always talked about a system, ecosystem, which is enabling system, which is much of doing is. Just to give us an example, what in the initial session, Professor Shud told, that we are coming with some of the regulatory framework which is becoming much more easy, enabled, and we are coming with a portal for all the approval system for drug and medicine. Of course, vaccine development is one of the important area. The next important area is whenever there is a natural calamity, we have an organization called National Disaster Management Authority. And we have with us member Dr. Butts with us. And when other day I met him, I learned already they are doing work in a great deal how to take care of the livestock during the time of disaster. But only thing is required now the synergy and some kind of a coordination between NDMA and the DASD so that we can come forward having a better disaster resilience. 7th is funding and 8th is regulatory framework. Not taking much time, since already we are little late, I will not say late for anything, but late to start. And there are couple of panelists are enlisted. So it will be, I am sure that it will be a very tough time to 2 of our chairs. I'll introduce them to you. Dr. H. Rahman, he is a regional representative of International Livestock Research Institute of Southeastern Asian region, and he was also a former DDG, Animal Science in ICR. And other chair is Dr. R.K. Singh, who was a Vice Chancellor and Director of Indian Veterinary Research Institute and Director of Equine Research Institute, and who are also working with us in tandem in One Health Support Unit, and he and his team was one of the key partners for us for developing this document. So I hand over to you, sir. And I think that what we would like to know from the department side, from this panel, you have the document with you, full document. It is just a framework document. We would like to know specifically how we can implement it in a better way in coming days. So that we have got two goals. One is the very early goals, which you can do in the next 1 year or 2 years, and then maybe 5 years down the line. With this hope, I hand over the mic to two of our learned chairs, co-chairs, Dr. Rahman and Dr. R.K. Singh, sir. Thank you very much.
नहीं पहली बार Thank you, Dr. Abhijit Mitra. Good afternoon to all of you. Respected Secretary, Department of Animal Husbandry and Dairying, Shri R.K. Singh Sahab, Dr. Abhijit Mitra, Animal Husbandry Commissioner and Chief Veterinary Officer of the country, Dr. O.P. Chaudhary Sahab, distinguished panelists, invitees. I hope some media persons are also still here, ladies and gentlemen. At the very outset, I am very much thankful to the department for inviting me to co-chair this session. I am really honored to do that. Dr. Mitra has already mentioned that we are already delayed by more than half an hour, and number of panelists are enlisted here. I'll request our experts or panelists to restrict their comments or their advice or whatever they want to 2 to 3 minutes, so that we can finish it on time. It's okay, I think. So then we'll start with. You
can do it all those vertical wise, the discussion. One vertical, 2 speakers, then the next vertical.
I think mix up is better, no? So that everybody will understand what you want. Our first speaker, you want to say something, Dr. R.K. Singh?
No, sir. Only thing we can, like we have imparted to stakeholders like from NDMA and CGD, so we can invite them first.
Okay.
I think it will be imparted to the others.
Dr. Krishna Bhatt.
I request Dr. Krishna Bhatt. Yeah, please. He will speak from there. Or?
Whatever.
As per your convenience.
That's how we request you for 2 minutes or 3 minutes. Just we want to go.
Good afternoon, respected Secretary, Ministry of Animal Husbandry, Dr. Abhijit Mitra, all the distinguished participants, experts. thank you very much for inviting me to this deliberation. We welcome this initiative, and we extend, on behalf of NDMA, I would like to extend our fullest support for this initiative. To make this initiative successful, it's very, very important that we conceive animal in emergencies or animal in disasters as one of the pillars. We cannot prepare for pandemic or epidemic unless we have a very dedicated capacity and program dealing with animals in emergencies. And it's even more important because the mortality of the animals needs to be brought down significantly. Yeah, I'm audible, I hope. So, yeah. So generally the mortality, the human mortality and the animal mortality is generally 5 times more than the human mortality in emergencies and disasters. And I think it's very, very important, though we don't have the database, but whatever we monitor, the mortality among the animals needs to be brought down significantly. To achieve this, there are few steps that need to be taken, and I will like to refer to them very briefly because I have just 2-3 minutes. First, it's very important to have a legal or a regulatory framework. We must have a policy regime for dealing with this situation. There are essential steps that we need to take. One, of course, is that we must have a local program, a local capacity for evacuating animals in large numbers. It's a capacity that we need to build. The second one is the safe shelter, that we need to provide safe shelter in large numbers, again at the local level. The third very, very important element is the veterinary emergency referral units that we need to. We have already a few veterinary emergency referral units, but they are very few in number. The number of VERUs, as they are called, needs to be expanded, and we must have a nationwide network of the VERUs. Again, what is also very important that we provide for feed and fodder in emergency situations. How do we procure and how do we provide them? It's a huge logistical operation that we must provide some capacity for procuring at a very short notice and be able to provide that in cattle camps and fodder depots. And so that is also a very, very important priority. We cannot do all these things unless we develop local level capacities. We have to have capacities within the local governments, Panchayati Raj institutions, the veterinary units, veterinary hospitals at the district level and at the block level, at the Tahsil level. So we need to work with the local governments and all the local health institutions over a period of time to develop these capacities. While doing all this, it's also equally important that we have a dedicated facility for wildlife too. We cannot ignore wildlife, and many of our national parks are seriously affected by floods and cyclones. So along with all the emergency measures that we take, we also need to create that capacity for wildlife. One of the biggest problems that we face right now is that we do not have a good database for developing this program. And it's extremely important that we collect the data at the local level and we maintain that data that provides us good information on animals in emergencies, animals facing disease situations, animals facing epidemic situations. So one of the important priorities is to develop a large database, nationwide database in dealing with emergencies and disasters. So I think these priorities are very, very clear. We have been working on these priorities for quite some time at the state level. We have some success, but I think this is the time for developing a national initiative. It's time for working together across the institutions, and that is why we are all very enthusiastic about this One Health mission, which brings together different stakeholders. So NDMA would be very keen to work with all the stakeholders. Ministry of Animal Husbandry, of course, is the leader, and we recognize that they have a pivotal role in this. But there are many other institutions too, and we would be very keen to work with all of them. And let's develop an initiative, and we will pursue it over the next 2-3 years. Thank you very much.
Sir. Just for the knowledge of all of you, that already we are developing. Thank you, Barji, for so very crisp note I have taken already. We are already developing a protocol and a SOP for how to, for a dead body or carcass disposal, because that is one of the issue which has been bothering all of us, that in case of any eventualities, natural calamities or any epidemics, what are the mechanism should be there for carcass disposal. So already we are preparing an advisory and a detailed document with the help of ICR. We'll be issuing it very shortly. Thank you.
Thank you, Dr. Krishna Vatsa, for your nice talk as well as the suggestion that you have given. I think somebody is writing the proceedings of that, recorded, it is being recorded. So now, the next I request Mr. Sanjay Shukla. He is the member secretary for Central Zoo Authority of India. That's of time.
Thank you, sir. Honorable co-chairs, oft as Honorable Secretary, sir, DHAD, Dr. Abhijit Mitra, my senior from my service, DHAD, all the panelists and delegates. So just I'll start with a talk like why wildlife sector has been altogether. If we see all three verticals in One Health, so it has been somehow we find that it has been missing. The development which should have been there in the wildlife sector is not there. Post-COVID only we realized the importance of wildlife when we saw that almost 70% of the transmittable diseases, they are zoonotic, of course, in the nature. When we look at the wildlife sector, we see that if you see the network of protected areas in our country, so the area is close to 5%, and we have more than 100 national parks and over 550 wildlife sanctuaries and about 150 zoo. But if you see the total setup and what should be the mechanism for surveillance or response or then data collection and management, there are just 150 vets spread across all these protected areas, only 150 vets in the zoo. So not more than 300 vets we do have in our protected areas and zoo. Whereas if you talk of the country on a nationwide level, if you talk, there are about 1 lakh veterinarians working in about 50,000 different facilities. If we talk of any proper data collection, that is missing. Surveillance, it is missing. No proper response. So fortunately, post-COVID, we realized the importance, and Dr. Praveen Malik, Dr. Sindoor, and many of the officers from the Animal Husbandry Department, they initiated the process. And we are now in the process of setting up of a national referral center for wildlife. So the major area of concern was like we should have a proper system of surveillance. So this would be rather with the help of the Animal Husbandry Department, like with the, on the lines of the National Digital Livestock Mission. So the first and foremost thing is to have a proper data. Then we'll, for the surveillance, and once this data is available with us, work on the data, analyze the data, do the modeling, forecasting, and make this data available at its different decision-making levels for further action, for the response. When we were taking a stock of our gaps which are there in the entire, when we talk of the disease management or health management, we had a stakeholder workshop on 10th of March, just in the last month. We realized that the availability of drugs, vaccines, even this is also missing for the wildlife. And when we see the interface, even in the G20, we are dealing with one vertical, like where we are talking about environment and climate sustainability working group. And there also, when we realize, when we talk of land degradation and loss of biodiversity, so this is also one of the very, very contributing factor where the animals come in direct contact with the human or the livestock. The land degradation, loss of biodiversity, this is also one of the factor which increases the more chances of interaction or interface with the livestock, human and wildlife. So here also we need to address to this problem also. So with the National Referral Center for Wildlife, this would be a coordinating center which we have proposed, and we have already started working on the DPR. And in the time to come soon, we should be having a center which will coordinate with all the regional centers across the country to address to the problem of wildlife health management. I congratulate the Department of Animal Husbandry and Dairying for launching these two very, very important initiatives, APPI and AHSSOH. So this surely be benefiting us also as wildlife managers. So I thank Department of Animal Husbandry and Dairying for giving me an opportunity to be a part of this program today. Thanks.
I have a point.
We can send the mic to the speaker.
Any volunteer, or I can volunteer it also. Okay, no, that's fine. मैं एक बार बता देता हूँ. One issue is bothering all of us is the wildlife disease diagnosis and disease reporting. What I was talking to you. And one of the issue also that, many time there is a kind of a miscommunication or lack of coordination in the much lower level. Like I go for a collection of a fecal sample of a wildlife. So somehow that is not happening seamlessly. So can we develop a SOP and a kind of a, so that how sample can be accessed, what would be mechanism, who collects, how it is collected, how it is delivered, dispatched, where. So if we can take a note in your ministry, and also one of the action point, that will be one step forward. Thank you. Thank you for volunteering.
Thank you, Mr. Shukla. Now I request Dr. Ms. Ritu Singh Chauhan. She is here. Yeah, please.
So thank you very much. It's indeed an honor and a privilege to be speaking in a meeting where there are all animal husbandry experts. I represent WHO Health Emergency Team, and we have been working in collaboration with the Ministry of Health to better understand how the disease emergence can be tracked and what is it that would really be needed for pandemic preparedness. And maybe I'll just come forward because it's becoming difficult. So one of the first points that I want to make for this program is about having the necessary knowledge of how do we interact with our communities. During the pandemic response, we really saw that countries that were able to build trust with their communities were able to better institute public health social measures for pandemic response. So really we have evolved from understanding that we need to not work for the communities, we need to work with the communities. which actually means that we have to really go deeper. It is not just the program of community engagement should not finish with printing of IC materials and printing of flyers and printing of information booklets that needs to be distributed. We really have to talk about active listening. Are we really listening to the concerns that our farmers, our veterinary workers, our paravets in the field have? So active listening is an important area which has emerged, and we have seen that in the case of a wildly spreading event, the fear travels much faster than the disease. So do we have the tools to stem misinformation, infodemic, which are often linked to any acute public health event? After the Nipah outbreak, I was deployed to Kerala, and we were working to understand how we could better build preparedness for further Nipah outbreaks. I can tell you, when we visited the house of the index case, the entire neighborhood had disappeared. That was the level of the fear. So it happens. People are scared of, outbreaks that have got high mortality. So what can we do to ensure that people have the right kind of messages? And we spend so many resources for pandemic response, but are we investing heavily in pandemic readiness, preparedness, which also means that we need to have certain contingency plans which are updated every year at state and district level to manage some of these pathogens of high threat potential. So the other point, sir, that I want to make is about risk assessment. When an acute event actually happens, we need much more going in terms of assessing what is the emerging risk of that particular zoonotic event, and we are now talking about joint risk assessments. We need to bring all the concerned stakeholders together for joint risk assessment and planning, and we know that as an event unfolds, the risks can change. The risks are also needing certain risk mitigation measures which need to happen on a continuous basis. Then the third point that I want to make is about after-action reviews, and WHO is really talking big time about after-action reviews. What does it mean? It means that after an event is over, did we understand what worked well, what did not work well, what needs more input? So after-action reviews help us to understand what more needs to be going on in terms of institutional strengthening, what additional inputs are needed to further train some of our medical and veterinary forces, as well as understand what are some of the areas which are emerging for further action. India is a huge manufacturer of vaccines and diagnostics, and still there are many zoonotic diseases for which we have very limited tools available. Last week we were sitting down with the Ministry of Health folks to understand what are some of the challenges, and we know the unmet challenge is huge, which means that we have to have whole of society engagement. We have to work with our pharmaceutical industry partners to better understand what are some of the diagnostic kits and reagents and consumables for which there is no capacity yet in the country. And I can tell you that if India leads in this direction, many other countries will be looking to India to make sure that we utilize. So we really have to set the way for the rest of the world. And a prepared India is a prepared world. My last thought is about the program itself. One of the major concerns that was noted during pandemic response and the review of the international health regulations, which is happening globally right now, has made it very pertinent that there has to be leadership capacity at every level. We need good leaders, not only at national level, but also at subnational level, at community level as well. So are we working with the key influencers in the community to ensure that we get the right messages to the field? Are our district level people empowered enough to bring the different sectors on board together to make sure that the right decisions and concerted policies are developed? And so leadership skills has far emerged as some of the areas for further work. We are now working extensively. Last year we have worked with the ICMR to build the leadership capacity in all the technical institutions. Many other public health and animal health institutes also need to build this capacity, not only leadership but also governance. I think governance is another area that we need to strengthen. Whatever resources that there are they being utilized effectively where it is needed? one important area is, of course, we know that India is a big country, and sometimes in some places, especially far to reach places, there can be deficient human resources. So how do we deploy? What is our surge capacity when there is an outbreak? We really have to work on developing our rapid response teams to such an extent that they have the necessary expertise, the skills and the knowledge that if there is a state or a district that needs support, they should be there to give it. So I will rest my case here. Thank you very much for the opportunity and happy to collaborate with you in future.
Thank you, Dr. Chauhan. Our next panelist, Dr. Ms. Divya Dutt. If she is here, she is not here. Please come, madam. She is from United Nations.
Yeah, let me also go in front.
You can speak from there so that everybody can see you.
Good afternoon, everyone, and thank you very much for this opportunity to UNEP to be present in this very important discussion. As DGHS said in the morning, we are talking a lot about One Health, but the environment side of One Health is still a little weak, and therefore we are very happy that we are able to contribute to this discussion. This context of COVID, everybody's been speaking about it. It's been a most recent sort of zoonotic outbreak, but as we all know and we've been discussing, it is not the first. We've over the last few decades, there have been several outbreaks which have had very severe consequences, of course, but nothing close to what we've seen during COVID-19. And as someone just said, 60% of all known infectious diseases and 75% of all emerging infectious diseases are zoonotic. So this is really something that we need to take note of. This rising trend in zoonotic diseases is, in no small extent because of degrading natural environment. And, this sort of land degradation, intensification of agriculture, wildlife exploitation, and climate change. All these are factors that are sort of accelerating zoonotic outbreaks. Recently, UNEP with the International Livestock Research Institute did a very detailed assessment of what is driving zoonotic outbreaks globally, and they identified 7 drivers of this change. I'm not going to read those out, but I just wanted to say that in addition to the increasing human demand for animal protein, unsustainable agricultural intensification, factors that we've been talking about, some of the other factors are unsustainable utilization of natural resources, which are accelerated by urbanization, land use change, and extractive industry. So, the point being that environmental aspects and environmental degradation is front and center of any action to address zoonotic outbreaks. And therefore, it's very important that, the Ministry of Environment is in this conversation along with other ministries, and I'm really happy that IG Forest is here. I also had a conversation just very recently with Simiji on how we can sort of mainstream biodiversity considerations into this discourse. I just wanted to very briefly sort of highlight a couple of things that UNEP is doing in this area and also offer this support to the government as it strengthens this work. One, you might already know there is an Interministerial Environment and Health Steering Committee, which is co-chaired by the secretaries of the Ministry of Health and Ministry of Environment. And that Interministerial Steering Committee also has working groups on specific issues. It will be very useful to have a working group dedicated to zoonosis control and see how in that steering committee, which has representation from a large number of ministries and departments, this issue can be discussed in some detail. We also recently did a study on basically scanning the literature that exists on the environmental dimension and the natural resource dimension of zoonotic outbreaks. And I have to say that we did not really find much literature. And this goes back to the point that was being made that we need to enhance scientific inquiry, we need to do better surveillance, at least as far as the link between environmental degradation, natural resource exploitation, and zoonotic outbreaks is concerned. We've also done 2 really good campaigns with the Wildlife Crime Control Bureau on addressing the issue of illegal trafficking of wildlife. And these campaigns ran successfully across the country at airports. One was called Not Your Medicine, where we were trying to bust the myth that people have, and this is of course not just addressing people in India, but globally, that wildlife products are not scientifically proven remedies for different diseases as people seem to believe. So there was a whole campaign run around it, and I think that's creating that awareness and sustaining those efforts at informing people is a very important aspect of whatever we decide to do. We've also done some capacity building programs for frontline enforcement agencies, customs, and CISF on sort of handling illegal trafficking of wildlife. And we are very happy to sort of continue some of these initiatives in consultation with the government. And I take this opportunity to sort of reiterate UNEP's support to the government on this very, very important initiative. Thank you very much.
Thank you, Dr. Datta. The next speaker, Dr. Baldev Raj Gulati, Director Nivedi from Bangalore.
At the outset, I would like to thank Animal Husbandry Commissioner and DAHD for giving us the opportunity to be part of this program. I was going through the APPI pillars. Out of 8 pillars, in first three pillars, Nivedi is already contributing since beginning, and Dr. Rahman has been former director Nivedi. He has been playing role, and I find it very pleasing to see first 3 pillars of APPI, where Nivedi was dreaming that should be the national program. So thank you, sir, for including them. So first pillar is the disease surveillance and monitoring. Here, Nivedi is helping the livestock DHD and the entire country in making the surveillance plans, surveillance frames, how disease data should be collected, and it is not that entire animal population has to be surveyed. Based on the plans, few thousand samples we collect and we can make the significant information. So that is where the role of surveillance and monitoring is important. So far we have been doing surveillance where the epidemiological unit has been either district level or the block level or at the most the village level. But the initiative that DAHD has taken under programs like National Digital Livestock Mission, where we are ear tagging each and every animal, now we are able to make one animal as the epidemiological unit for making the real-time disease investigation. As we have been collecting data from the country, it has been a time gap of about 1 month from the outbreak occurring at any state or any village. It used to take 1 month to reach the data at our end and to do analysis another 15 days. But now the real-time disease reporting, where Nivedi and DAHD are trying to collaborate in National Digital Livestock Mission, wherever the first report occurs, the frontline worker, either the veterinary surgeon or the VLDA, whenever he reports, the system generates the alerts, and based on those alerts, we can make the prediction and forecasting using AI, machine learning, and disease modeling. So this is where Nivedi will be collaborating with DAHD in making the real-time alerts, rather than making, so far what we are doing is, based on the monthly data we get, we generate risk 2 months in advance. So for example, we have already generated the risk of livestock diseases for the month of July, based on whatever data we got in April, that we have already communicated to our stakeholders. But the way the technology is going to help us, based on the real-time data reporting, we will be able to generate the alerts at least 3 to 4 months back, 4 months in advance, so that there is sufficient time gap to take necessary measures to prevent those disease risks. So that will be a useful contribution of the DHD and APPI initiative, where Nivedi will be collaborating with the DHD. Then disease modeling is another area, emerging area. The pandemic of COVID-19 has already demonstrated that with few cases of incidences of some disease, using the various disease modeling, different mathematical algorithms, we can make real-time correct estimates of the disease. So similar things we are doing already using artificial intelligence and machine learning for at least 13 different livestock diseases, and we are making forecast and forewarnings for different diseases. Now, with the smallest of the data, for example, LSD, when it came first outbreak, if we get that real-time data and we create real-time alert, how much that would have been significant in controlling or preventing the spread of diseases like lumpy skin disease or African swine fever that spread into entire country. So this is one area where significant contributions can be made by using the appropriate mathematic modelings and disease modeling systems. So here, Nivedi is already playing significant role and will be contributing to the DHD in that direction. Then third pillar, the outbreak investigation or the epidemiological investigation. That is very, very important for preventing and control and spread of the diseases. And here, the competence, although epidemiology is one of the oldest science, but competence in the field of epidemiology is very, very less. So Nivedi will be helping in this program in developing the competence of the livestock handlers, the veterinary surgeons or the field workers in how to go for outbreak investigation and epidemiological investigation. That will be one role that would like to play in this program. As Dr. Shukla said, Shukla Saab, about the wildlife, we do not always take into consideration wildlife because we do not have the population data of the wildlife. So once we develop the population map of wildlife in our country, and then we start working on the disease maps of wildlife, definitely we will be able to prevent many zoonotic diseases that are emerging. These are some of the points I wanted to say. Thank you very much.
Thank you, Dr. Gulati. Our next panelist, Mr. Adarsh Kumar. Is he here? Please. Mr. Adarsh Kumar is from World Bank.
Thank you. We've been part of this, developing this program design, I think for the past 18 months or 2 years or so. So I'll keep my comments brief and broad. I think two sets of things I wanted to use this occasion to flag. I think one, there is some of the hard interventions such as sort of improving the quality of veterinary facilities, diagnostic facilities, I consider relatively easier to do. Some of the soft things that is our ambition to do as part of this program, I think are much tougher and require sort of actors to coordinate even outside of DHT and across ministries. And this is an area that we really sort of want to focus on moving forward. I think three broad areas. So one is around institutional capacity. I think issues like which other speakers have flagged, so improving the accuracy and quality of disease modeling and forecasting. How does the system respond to that forecasting by concentrating resources based on what those forecasts are saying and where disease risks and sort of geographies are in the states and on the ground. I think these require a very sort of focused attention by the respective ministries to actually make this happen. On One Health, a quick point, I think it's an old concept where we always stumble when trying to implement it concretely. I'm very happy that our program focuses on 2 or 3 very specific things. On AMR at the state level, developing a plan and looking at how livestock and the use of antibiotics in livestock and animal products, how do we do surveillance and build it into the overall AMR plan. On wildlife surveillance, as Dr. Mitra just said, sort of bringing it down to actual SOPs and making it happen. And third is on joint training and of personnel across wildlife, animal and human health on both sort of preventive activities as well as outbreak response. Big ignored area, I would say, which is really important and this program invests in, is in extension to farmers. I think our extension systems have not adapted fast enough to the much larger role that livestock now plays in the agricultural sector. And I think building in good animal husbandry practices, biosafety and biosecurity measures down to the community level will grow a long way towards improving animal health management and zoonosis prevention. Lastly, I think one of the areas that we perhaps in our own program haven't been able to get a clear line of sight to, but we think is critical moving forward, is how do we leverage the private sector? And I think this is something we look forward to working with DHT on. Just as in human health, private investment has sort of exponentially increased India's health capabilities. How do we bring in the private sector into some of the specific areas like veterinary service provision, diagnostic capacity? I think this is something that we really need to push. We at the World Bank, I think we again look forward to sort of knowledge exchange. So we've already started looking at a program of bringing in sort of what other countries are doing. We had one session earlier when Dr. Malik was there with some of the examples, Reddy's from East Africa on disease surveillance, the laboratory information system in Thailand that's been developed. So I think this is also something that we hope to sort of jointly do with DHT going forward. Thank you, and wish this program is very successful.
Thank you, Mr. Kumar. I next request Dr. Bijay Makhija. He is the president of Indian Federation of Animal Health Companies.
Good afternoon, ladies and gentlemen. First of all, thank you and privilege and honor to be here. Thank you, Dr. Mitra, sir, for this opportunity. And others, I am from private sector. So you are talking about engagement with private sector. So here I am. So INFA stands for Indian Federation of Animal Health Companies, comprising of 53 members, which contributes close to 80 to 85% of the entire animal health and nutrition sector. So our colleagues are serving the animal health care access to every nook and corner of the country. These 53 members are spread across the country, and with thousands of our colleagues, we are providing to the access of animal health and nutritional product to the last mile, that is our farmers. Our motto is healthy animals, healthier India. Why animal health is important? I'll just say relevant to sustainable development goals. Goal number 1, no poverty. Because of livestock farming, you will see our contribution to the GDP is significantly increasing. So livestock farmers, if they are efficiently producing the food, animal origin food, they are wealthy. No hunger. Honorable Minister also said that our role is to contribute for the safe food, not only the nutritional security, but also the food safety we are ensuring. Third, good health and well-being. In the COVID time, we have seen a rapid adoption of the pets. Why? Because pets gave the comfort to all the people who are rearing them. And last, climate action, goal number 13. If the animals are healthy, it's proven that their carbon emissions or other emissions would be lesser. So it will have a very positive impact on the environment. Now, a great session since this morning, and compliments to the entire team who have developed this APPI. So I'll focus on the pillars, what we have narrated here. Few of the pillars, I have a certain appeal to the leadership of this organization. First, disease surveillance and monitoring. So we like to appeal that if there is a proper structured program where the data is shared of the disease monitoring and also the surveillance, insights coming from this data, interpretation of this data, and as Rajesh Singh sir mentioned, the economical impact. So the most important thing is how much economical impact we can estimate through this data analysis. So I'll request all the work stream who are working on this data of disease monitoring and surveillance, how it is going to economically impact us, because we are from the commercial organization, we like to understand how we can collaborate with these agencies. Second one, about creating disease model algorithms and early warning and response. Fantastic topic, because the world is moving towards prevention rather than cure. World is moving towards proactiveness rather than reactiveness. That's why Honorable Minister also mentioned the word preparedness. So if we can focus on developing a digital ecosystem where we can diagnose the diseases at the earliest stage for the technology like monitoring devices at the farms, so that we can get to know what are the things which are going unwell in the animals, then we can be more efficient. Sir, it was a music to my ears that you mentioned that a regulatory portal is coming up which will provide a transparent, predictable, and quicker access of the animal healthcare products of vaccines and therapeutic products. So, sir, we are the ones we are going to use this portal. So my humble appeal is that if there is a provision to have a preview session with our members or some kind of sharing with the members, because they are the ones who are the actual beneficiary of this portal. So we like to collaborate, and sir, I invite that you present this portal to our members. All 53 members will be delighted with this initiative. So compliments from entire INFA fraternity. Now coming to the funding part, Dr. Chaudhary sir is here. So sir, we have been actively engaging with you on the AHIDF program, and my appeal to you is that if there are certain success stories, please share with our members, because when we see the success actually happening on the ground, more and more members will be motivated and inspired to leverage this scheme. Moreover, Dr. Malik is here, so recently you invited us to look at the technologies which are available in different research institutes. So, sir, it was first time we got such a wide variety of information available, so more such interactions at the institution level, if they are like industry IVRI meet or industry other NDRI meet, if these are more organized, so we can definitely collaborate and see what technologies industry can commercialize for further dissemination to the last mile. Lastly, vaccine development, other R&D, definitely this is our core expertise. So we have close to 18 members who are into vaccine production and marketing, providing access to the farmers. My appeal to you is that if there is a particular program by the department where all our stakeholders come and share the need gap analysis, for example, where are the needs, which are the vaccines are still to be made accessible to our country, perhaps then regulators can evaluate whether this disease impacting economically and also to the farmers. So these are my few requests and appeal, and once again congratulations to all the leadership for such a fantastic session. Thank you so much.
We'll have an online virtual show next week. Thank you so much.
Thank you, Dr. Makhija. Now I request Dr. Praveen Malik. He is the Chief Executive Officer, Agri-Innovate, former AHC, Animal Husbandry Commissioner.
Thank you very much. Very good afternoon, all the dignitaries present in this house. Lot has already been said, and because I was involved with this program since beginning, when we started thinking about it, discussing with different stakeholders, got the guidance from the Office of Principal Scientific Advisor, got the things from the private sector and all those things. पहले एक छोटी सी मैं एक ब्लीक सिनेरियो आपको थोड़ा सा बताना चाहता हूँ, एंड व्हाई दिस प्रोग्राम इज सो इम्पोर्टेंट एंड द लॉन्च इज सो इम्पोर्टेंट टुडे. लास्ट मंथ 20th मार्च को IPCC की AR6 रिलीज हुई है, एंड इफ़ यू हैपन टू गो थ्रू दैट पर्टिकुलर, इट्स अ वेरी ब्लीक सिनेरियो. 1890 to 1900 में जो टेम्परेचर था, आज हम 1.1 डिग्री सेल्सियस वार्मर हैं, and we are going to be warmer by 0.5 in at the most next 10 years. जो उनके सिनेरियो है 2030 to 35, they say we are going to reach 1.5 if we are not stopping everything right here. And beyond that, they say by 2100 we can be around like 2 degrees. जो मुझे लगता है नहीं 3 होना चाहिए. The way we are working, उस ग्लोबल वार्मिंग के इम्पैक्ट्स, वी आर नॉट टॉकिंग ओनली अबाउट द इन्फेक्शियस डिजीजेज, वी आर टॉकिंग अबाउट माल न्यूट्रिशन, नॉन कम्युनिकेबल डिजीजेज, वी आर टॉकिंग अबाउट मेंटल हेल्थ, इम्यूनिटी ऑफ ऑल दीज एनिमल स्पीशीज, वी आर टॉकिंग अबाउट डिस्प्लेसमेंट, माइग्रेशंस. और इसकी वजह से जो इम्बैलेंसेस आने हैं नेचुरल रिसोर्सेज के ऊपर, जो इम्बैलेंस प्रेशर आना है, उन सब का इम्पैक्ट आना है डिजीजेज के ऊपर इन वॉट एवर सिनेरियो. So this is a very timely release from the Animal Husbandry Department, and would like to compliment and congratulate the leadership sitting here, present Secretary Animal Husbandry, Mr. R.K. Singh, present Animal Husbandry Commissioner, Dr. Mitra, पुरानी leadership हमारे Secretary Mr. Chaturvedi and all. So compliment to them. तीन बाकी चीज़ें कह दी गई हैं. आई वुड लाइक टू एम्फेसाइज ओनली ऑन 3-4 मेजर फोकस एरियाज विच आई थिंक आर वेरी वेरी इंपॉर्टेंट. पहली चीज़ तो व्हेन वी से सर्विलेंस, वी नीड टू शिफ्ट फ्रॉम द एनिमल ह्यूमन सर्विलेंस डायरेक्टली इनटू सम काइंड ऑफ एनवायरमेंटल सर्विलेंस विच वी हैव ऑलरेडी स्टार्टेड टॉकिंग अबाउट, वेयर वी नीड न्यूअर टूल्स. हम कहते हैं सर्विलेंस होना चाहिए, इट्स वेरी गुड पॉइंट, बट देन सर्विलेंस इफ इज बेस्ड ओनली ऑन लेबोरेटरीज will be very, very tough. Probably we need to shift from the laboratory surveillance into the field surveillance kind of mechanism, whether it's environment. So we need better tools. और इसके लिए when we are talking about involving wildlife, involving human being, involving animal sector, probably we need to come up with better antibody independent tools. Species specific ना हो. अगर वो generalized tools होंगे where we can detect on certain diseases, or their indications, maybe indirect ones. So we need these kind of newer tools for environmental surveillance also, for the animal, human and wildlife surveillance also, some kind of antibody independent tools kind of thing. Second thing, when we are talking about the use of the AI/ML, we need really the robust data, and this data will only be generated through these tools. और tools के साथ the utility, who is the reporter of that particular disease, if it comes through to the laboratory, when it is required by Nivedi in the real time, probably it will not be real time if it basically is coming through some mechanism. So सबसे अच्छा tool होगा कि already NDLM में lots of information has already been given. If you can provide point of care diagnostics, if you can provide some kind of tools which can be utilized right in the field and can be put into the central database, it will be more real-time information and can be better utilized through AI/ML mechanisms and neural networks, where we can talk about disease modeling, which can give us a better indication of how we should behave, how we should respond to that particular scenario. एक प्लेट हमने इसमें वर्टिकल दिया कि R&D की रिक्वायरमेंट है. सो R&D में हम पॉइंट ऑफ केयर डायग्नोस्टिक्स की बात करते हैं, बेटर टूल्स की बात करते हैं, वैक्सीन्स की बात करते हैं. बट व्हेन वी टॉक अबाउट वैक्सीन्स, कैन वी टॉक अबाउट सम काइंड ऑफ कॉमन प्लेटफॉर्म्स फॉर द वैक्सीन डेवलपमेंट फॉर ह्यूमंस एंड एनिमल्स टुगेदर. सारी वैक्सीन एक जैसे बनती है, इनिशियल हमारे प्लेटफॉर्म सिमिलर हो सकते हैं, एंड प्रोडक्शन के बाद जाके वी कैन एक्चुअली डाइवर्ज इनटू डिफरेंट सिस्टम्स. अब इस वैक्सीन में हिंदुस्तान की अपनी एक इशू है कि हम 99% डिपेंडेंट हैं हमारे गवर्नमेंट सेक्टर के ऊपर. Sitting at Agri Innovate, when I am talking about the vaccine development mechanism, transferring it to the private sector, वो लोग ले जाके इसे बनाने की कोशिश कर रहे हैं. I personally feel we are lacking some kind of data generation at that time, और it's not true only on vaccines. अगर मैं एग्रीकल्चर में देखता हूँ, हम इंसेक्टिसाइड पेस्टिसाइड की बात करते हैं, वहाँ CIBRC के रिक्वायरमेंट है कि उनके डाटा जनरेशन की, टॉक्सिकोलॉजी डाटा की. साइंटिस्ट पेस्टिसाइड बना रहे हैं, फॉर्मुलेशंस बना रहे हैं, बट दे आर नॉट generating the toxicology data. Similarly, vaccines बन रही है, but we are not generating that kind of data which is required by the regulators. अब रेगुलेटर में जो रेगुलेटरी को अभी मखीजा साहब ने भी कहा कि आपका जो अप्रूवल प्रोसेस को स्मूथ करने के लिए एक हमारा पोर्टल बन रहा है नंदी के नाम से. सो दैट पोर्टल विल बी इंटीग्रेटेड विद सुगम पोर्टल ऑफ CDSAO. अब इस पोर्टल में डालने के लिए डाटा तो चाहिएगा. वो डाटा क्या सिर्फ लेबोरेटरीज बना रही हैं या उस फॉर्मेट में बन रहा है जिस फॉर्मेट में चाहिए रेगुलेटर्स को. इंपॉर्टेंटली उसके अंदर मुझे लगता है कि कोलैबोरेटिव इन्वॉल्वमेंट चाहिए R&D के अंदर प्राइवेट सेक्टर का, विच इज़ वेरी मच लैकिंग इन माई कंट्री. सो माई हम्बल रिक्वेस्ट फ्रॉम द प्राइवेट सेक्टर ऑल्सो इज, एंड ऑल्सो द सिस्टम, if we can involve the private sector, encourage them to bring in some kind of R&D mechanism within the system, क्योंकि लेबोरेटरी बेस्ड में जो हमारे आउटकम आ रहे हैं दे आर नॉट डायरेक्टली एप्लीकेबल टू द इंडस्ट्री. सो वी नीड टू जनरेट इंडस्ट्री फिट टेक्नोलॉजीज, एंड दैट विल कम ओनली थ्रू द इन्वॉल्वमेंट एंड कोलेबोरेशन विद दीज मैकेनिज्म्स. और अगर ये सारी चीज़ें हम बना पाए, बिकॉज दे नो व्हाट डाटा इज रिक्वायर्ड फॉर रेगुलेटरी अप्रूवल. सो जो हम ये क्विकर अप्रूवल मैकेनिज्म की बात कर रहे हैं, पोर्टल इज जस्ट अ मीडियम, उसके पीछे डाटा तो लगेगा ही. सो दैट डाटा ECH का मैकेनिज्म, रेगुलेटरी अप्रूवल का मैकेनिज्म विल बी हेल्पफुल, एंड we need to simultaneously think about the emergency approval processes also. कोविड में डिजीज आई, आप लोगों ने देखा कि बहुत तेजी से हमने 2 वैक्सीन बहुत जल्दी से अप्रूवल के लिए भेज दी गई. क्या इसके लिए ये स्पेसिफिक केस सिनेरियो ना होके कोई मैकेनिज्म जनरेट हो सकता है वेयर वी कैन एक्चुअली टॉक अबाउट इमरजेंसी अप्रूवल मैकेनिज्म. कोऑर्डिनेशन की बात हम कहते हैं, कोऑर्डिनेशन हमारे टॉप लेवल पे बड़े अच्छे भी हैं, स्टेट लेवल पे भी ठीक ठाक बनते जा रहे हैं विद द आफ्टर दिस कोविड इंसिडेंट्स, बट हमारे एग्जीक्यूशन के लेवल पे कितना कोऑर्डिनेशन है, what kind of coordination is required, and I hope with this particular program we'll be able to do that. Last point कहते हैं communication strategy is a part of these programs also. ये communication में we need to actually look into the target audience for these communications, whether we are talking about the farmers. Biosecurity की बात अभी किसी ने कही है कि we need to teach them like that. Veterinarians, health services, इन लोगों के लिए भी हमें अलग से कम्युनिकेशन मैकेनिज्म डालना पड़ेगा. माई सिक्योरिटी सर्विसेज, क्या हमारे पास कोई ऐसा मैकेनिज्म बन सकता है कि मुझे कहीं कोई इंडिकेशन दिखाई दिया और मैं 100 नंबर पे, 1962 पे, 108 पे कोई एक इंफॉर्मेशन दे सकूं कि दिस इज द इंडिकेशन एंड रेस्ट ऑफ द थिंग्स इन मेरा मैकेनिज्म कैन टेक अप. वो हमारे पास अभी तक हमने सोचा नहीं है. पॉलिसी प्लानर्स के लिए अलग से कम्युनिकेशन मटेरियल होना चाहिए. इंडस्ट्री को, रिसर्चर्स को, एकेडमिया को अलग अलग तरीके से हमें जनरेट करने की ज़रूरत है. और इसके बाद सबसे इम्पॉर्टेंट है, एंड प्रोबेबली डॉक्टर सिमी विल बी हैप्पी टू हियर दैट, हम कहते बहुत है यहाँ खड़े होकर कि वी नीड टू शेयर इन्फॉर्मेशन, पर हमारे पास अभी तक कोई मैकेनिज्म नहीं है कि विच इन्फॉर्मेशन, हाउ मच एंड हाउ इट विल बी शेयर्ड इन रियल टाइम. इन्फॉर्मेशन है, अप्रूवल लेने के प्रोसेस में वो रियल टाइम खत्म हो जाता है. कितना फिल्टर होके जाता है, कब फिल्टर होके जाता है, बहुत इंसिडेंसेस हैं जिसे हम एक्सप्लेन कर सकते हैं. सो वी नीड टू कम अप विद ए इंफॉर्मेशन शेयरिंग मैकेनिज्म एंड स्मूथ एंड टाइमली फ्लो ऑफ दैट इंफॉर्मेशन इनटू दैट सिस्टम. लास्ट पॉइंट मैं ये कहना चाहूँगा, ऑल्दो इट्स नॉट रिलेटेड टू दिस पॉइंट, बट विद वन हेल्थ मिशन वी आर टॉकिंग अबाउट, वी आर सिंपली इग्नोरिंग the agricultural sector, the soil health, the water health, the kind of environment health. सारा का सारा वन हेल्थ सब बोलते हैं कि इट्स अ डेलिकेट बैलेंस ऑफ द होल इकोसिस्टम, बट उसमें हम जो हमारे फूड के बहुत सारे कंपोनेंट हैं जहाँ से जनरेट हो रहा है, वी आर मिसिंग ऑन दोज. एंड इफ वी कैन इन्वॉल्व, बिकॉज देज आर अल्टीमेटली अफेक्टिंग द एनिमल पॉपुलेशन, ये एनिमल वाइल्ड लाइफ हो, ह्यूमन हो या लाइफ स्टॉक हो. So animal species से पहले जो मेरी living or non-living system है मेरे ecosystem का, can we actually think about like what kind of information, what kind of awareness generation is required for those stakeholders which are involved? So these are also required to be touched upon through this particular mechanism. So thank you very much for giving me this opportunity, and congratulations to the department once again for this wonderful initiative. Thank you very much.
Thank you, Dr. Malik. Now I request Dr. Simi Tiwari.
Colleagues, now we have very little time, so I request all of you to kindly be a bit prudent in terms of timing, please. Actually, they have another program at 3 o'clock, and our time was up to 1:30, which we are, I think, approaching, so this is for your consumption.
A very good afternoon to all of you, respected dignitaries on the dais. A big congratulations, a big round of applause to the Animal Husbandry Department for this wonderful initiative. And I know in my 14 years of regular service, I have worked with 3 Animal Husbandry Commissioners, Dr. Suresh Hon'ble, then Dr. Praveen Malik, and now Dr. Abhijit Mitra. And I am seeing the constant efforts which are being put in by the veterinary sector towards realizing and operationalizing One Health mechanism in true sense. And it is a great leadership, the path shown by especially Dr. Praveen Malik sir, because this was conceptualized at his time, and he has done all the work up by, I have seen working Dr. Dabulina Mitra, Dr. Aruna Sharma madam, and the whole team at the Animal Husbandry to bring this wonderful initiative on platform. So the journey with the NCDC and DAHD is not new. We have been working together in many outbreaks, although it had been an event-based collaboration, but now gradually moving with inception of One Health mission towards a systematic collaboration and coordination. Sir, you have very rightly said that the information, by the time we pass on the information about any event, it is too late. But now with your collaboration and with coordination with many of the stakeholders and under the leadership of Ministry of Health, the digital integrated digital platform on One Health, we have already moved a step further, and we have worked, we are studying, systematically studying is being carried out, understanding all the websites and digital platforms available, what is being captured, what is the depth, what are the data nodes, what are the periodicity. So this whole exercise is being undertaken in a systematic manner, and I think before we conclude this G20 presidency, the Ministry of Health that would be able to showcase an integrated digital platform on One Health. I am quite hopeful that all the stakeholders, they will collaborate and cooperate with the Ministry of Health to understand their digital portal, so that we can come up with some kind of modeling exercise and early warning signals exercises and timely information sharing mechanism in a systematic manner. NCDC has already have 3-4 programs which are based on One Health. My only appeal and urge to all the stakeholders, and especially this animal pandemic preparedness plan, institutional and operational mechanism, to tap out the already existing resources so that we do not replicate the things. Although it required a lot things to be done towards animal husbandry system, because we are looking forward to have a more robust veterinary system strengthening, starting from the grassroots up to the regional, state, and up to the national level. So my all wishes, and wholeheartedly we are always with you. Veterinary sector is one of the important collaborator with us, along with the wildlife and the climate initiatives, climate health initiatives. So we are all one, and we all work together with a common zeal, shared vision, and shared objectives. Thank you very much, and big congratulations. Thank you.
Thank you, Dr. Tiwari. Actually, I'm very much sorry I have to leave. I have another meeting at 2 p.m. I have to leave because that meeting is with our DG himself. So I have to attend that meeting. Once again, I thank the department, particularly the Secretary Sir, Dr. Mitra, for inviting me and involving the international organization in this meeting. Before I request Dr. R.K. Singh to continue and complete the rest of that part, what initiative ILRI has taken for preparedness? ILRI has taken an initiative for preparedness for transboundary animal diseases, because I am representing South Asia, 8 countries. This is not for India, particularly now initiated a program for 4 countries. Those are having land boundary with India: Bangladesh, India, Nepal, and Bhutan. And this is supported by SAARC, ICR, and NAS. Another initiative we have taken, that is the development of vaccines for some exotic diseases. But the African swine fever has already entered in the country, but we are also developing the vaccines for another 2 diseases. Those are, anytime it may come, particularly the MARS, Middle East, the severe Middle East respiratory syndrome, that is already Iran, even maybe it is Pakistan is also there. Anytime that we are also trying to develop that vaccine. Another disease is the Rift Valley fever. Because of the transportation, because of the communication, that disease may enter anytime. That's why we have taken initiative with the Government of India as well as with ICR. These are some of the initiatives. And we are also giving the training for many scientists, particularly animal disease economics. How to calculate the disease impact, how to calculate the disease losses. When I was director, Dr. Gulati knowing, we have calculated the economic losses for foot and mouth disease. It was 23,000 crore rupees. But that time, we are not following exactly how to calculate the disease. It may be much higher, but now the people from IVRI, people from Nivedi, and many people we have trained, and they are calculating much better way. That are some of the things we have taken initiative. At the last, I wish the Ambedkar Jayanti, happy Baisakhi, Bishu, and Bihu as well. This is Bihu for us, and Pehla Baishakh for Bengal. Thank you very much for giving this opportunity.
Big applause to our chair, Dr. Rahbat sir, for sparing time and leading this session. So colleagues, now we are left with only 25 minutes. Of course, we are taking leave now. Our time is already over. So we still have 5 speakers. So I'll request Dr. Jyoti Mishri for quick comments, please. I think if you can give mic there also, that will suffice.
That will save at least after second.
Yes. Quick comments, Dr. Jyoti, please.
Thank you, Chair. I thank the organizers for taking this unprecedented, important issue into cognizance. I also thank the DHD for this. I think the COVID-19 has upended the whole world, and that has made us to believe in collaboration and more cooperative approach from the different stakeholders. So I was going through APPI and this endemic Animal Pandemic Preparedness Initiative and the One Health Animal Support System. And what I could realize that I would emphasize that there should be a top to bottom line approach and the willingness to implement the guidelines, the protocols which are already there. So that becomes very important, and regular monitoring at the district level, at the local level, at the regional level, so that whatever we have in hand, how much it is implemented at the block level, at the taluka level, that becomes very pertinent. So I would emphasize only few points because I know the time limits also, and I have vast experience of working in the emerging infectious diseases, then zoonotic diseases, and also the antimicrobial resistance, which forms the main hub of the One Health. So I would emphasize strengthening preparedness and response through laboratory diagnostics. Point of care diagnostics is very important for the disease surveillance, be it environmental surveillance, because if we have effective diagnostic systems, we will not go only with the few selected diseases for surveillance, but we need to go for the diseases which are not normally taken into cognizance. So we should have a very strong point of care diagnostic system in hand. And then outbreak investigation, rapid response teams, that should be in joint investigation teams from all the stakeholders, and their areas and technical lines should be deliverable, what they would do at that point of time. That becomes very important. Then outbreak investigations, how we are carrying out, do we have some standard SOPs for that, and definitely a well-reporting system is very important. We always go with the under-reporting, and can we initiate some sort of incentives for the reporting system? That becomes very important, as what I have seen that at most of the levels, reporting of the disease which has an economic impact on the trades, so that is being, I think it becomes a very unhappy situation there. So a reporting system is very important. And then connecting laboratories through veterinary diagnostics laboratory, vet lab network, that would help to channelize the expertise and coordinate actions at all levels. So I would personally say that animal health specialists should collaborate not only with the clinicians or physicians, but also with, there should be some biostatisticians, then epidemiologists, ecologists, and besides wildlife personnel also to have some sort of pertinent information and what it has on the society, societal impact, so that becomes very pertinent. Then yes, building genomic and environmental surveillance methods to improve the timeliness and sensitivity of the disease detection and monitoring mechanism is very important. So I would emphasize on the ecosystem coordination, then integration and evaluation of the data sharing, and how we will evaluate and come to the conclusion from the data which we collect from all the sectors is very important. And for the AMR, I would also specify that it is not only the bacterial pathogens which are important, but definitely the fungal pathogens, what we have seen after COVID-19 pandemic. So that becomes very important. We need to work on that also. Then I have emphasized ICT-enabled knowledge-based system, which would give a very thorough knowledge about the disease system in the locality. And yes, as has been said, that environmental surveillance and wildlife surveillance is very important. And because it is not that animals, they are taking more of the antimicrobials or they are, but maybe animals may be getting from the environment. So that is important. Thank you, Chair.
Thank you, Dr. Jyoti. I request now Dr. Prijit Nambiar. Dr. Prijit had been working in One Health at Kerala Veterinary Animal Science University. Now he has joined as technical officer as WHO. So relevant comments, but brief.
Good afternoon, one and all. Okay, so prior to joining WHO, I was an academician, and whenever I go to a class, I just always try to keep an story behind it. Like, for example, can the audience tell me a disease which causes 100% mortality, but at the same time is 100% preventable? Rabies, well and good. So now, because of pandemic, that story is to the nation. We all have lost some of our loved ones due to the pandemic. So this is the right platform wherein we all address the pandemic issues. So as you see here, pandemic preparedness, there are 2 Ps. I'm going to add another 4 Ps. 1 P is prioritization. We have to sit together and prioritize most important zoonotic disease, which we have to address. See, there is a vast array of zoonotic diseases, and it's difficult for both the sectors to address them together. So we need to prioritize at least 6 zoonotic diseases to start with, and then we have to, beyond our boundaries, we have to share the data. We have to, within the countries, everything is fine because it's all the data which we have. And that way we can take forward the important message of zoonotic diseases. The rest 3 Ps are, of course, we have the planning, program, and another P is person. So when I talk about person, I'm very much happy that recently the Animal Husbandry Department have come up with an A-HELP. I was speaking to Dr. Sulekha ma'am. Just like the human health sector, the vast majority of people are ASHA workers who are the base level people who can collect the data. We have A-HELP now, and that can be replicated in other parts of the states also. So that, see, those are when I can give you an example of a country in Thailand, app in Thailand. So that is called as participatory One Health disease detections. So that is a mobile app wherein when a particular farmer, if he or she identifies a disease, he just takes a photographs of the symptoms and it's sent to a particular person, say suppose a ASHA workers or AL person. So he'll be actually monitoring whether that is a issue which has to be dealt at higher level. And that way it will be reported to the veterinaries, the authorities, and they'll be identifying it. So at the grassroots level itself, we can derive a solution if we have some more app of that. So I think Nivedi are working on that. Another, after coming to WHO, I came to know the beautiful IHIP platform which is existing here. In veterinary sector, it's under development phase, but what I want to say is that if we have a platform like IHIP and where this data can be integrated, where especially the zoonotic disease data, which Simi madam is currently working on, it's going to be the best platform in the world. Because we are catering a population of nearly 1.4 billion, and through IHIP we can come to know who is having dengue virus in which state, in which population. Here now in animal husbandry sector, we even have the Pashu Aadhaar, even animals having identification number. So likewise, this type of portal can be integrated well, and once we integrate it well, definitely the data can be managed well. All this type of simple pandemics can be easily dealt once we have the data with us, especially the government authorities. So I want to restrict my talk. I have a lot to speak, but I want to restrict here because of the lunch time. Thank you, one and all.
For your response, and that too very quickly. Now I request Dr. Chakravarti. Dr. Tosh is a scientist at near South Bhopal. Dr. Tosh, I think your comment on environmental and genomic surveillance would be most apt.
Thank you for giving me this opportunity. And you know, this NISAD is famous, known for avian influenza, but it is not only the flu we are working on emerging animal diseases, including zoonosis. And in this aspect, a lot of speakers have told about surveillance. So just I want to go deeper into this surveillance because surveillance is the cornerstone of disease control. It is whether you say disease is there or not, you have to do surveillance. If it is present or absent, you have to go for surveillance. So going to surveillance, we should have that the laboratory capacities, like harmonization of the protocols, because we should have a uniform laboratory protocol for detection of the disease, because we know that when there is emergency situations, there is mortality or there is sickness, we detect the virus and give the results. But when there is no mortalities, but still the disease is, it is undercurrent. So how to detect that? So that we should have the harmonization of the protocols and also the quality assessment system, because we know that we have a laboratory, we have real-time PCR, so many things, but we should have a quality management system in all the laboratories, including the reference laboratory. Then we should have the prioritization of the disease. It is not only the zoonotic diseases comes under the One Health. It is all the emerging diseases that affects the animal production and health, which is in turn affects the human health also. So we should have prioritized the disease and also the reference laboratory. Who is the national reference laboratory to say for confirmation of the disease and reporting of the disease to the international organizations as a international obligations. And another is after the disease identification, how the virus or the disease drive, what are the drivers of the disease spillover from animal to humans, that needs to be surveyed and studied. That is the research aspect. And how to stop that spillover from the animal source to the human source. That is also another important aspect. These are the very few things. I have a lot of things, but this is very, very crispy. The harmonization of the protocols, the quality assessment system, the drivers of the spillover, and how to stop that spillover from human-animal interface. These are the few points I want to say. Thank you.
Now I request Dr. Vinod Verma for comments, please. Dr. Vinod Verma is Vice Chancellor of Lala Lajpat Rai Veterinary and Animal Science University at Hisar.
Thank you, Dr. R.K. Singh. Good afternoon, dignitaries of the dais. I'm Dr. Vinod Kumar from Lala Lajpat Rai University of Veterinary and Animal Sciences. And I'm representing actually the universities. I'm the only Vice Chancellor here. And let me say the role of universities that can play in implementation of this ambitious program. And we know that the universities have its own ecosystem. You know, they have the students, they have the faculty for teaching, research, and extension purposes. So universities can be involved in many ways for the implementation of this program, and there are very core areas where universities can be involved. Say for example, data recording system for the data recording system for investigation of disease and outbreak, response teams, disease surveillance system, vaccination development system, and diagnostic development and therapeutic development, and so on. Then disease monitoring system is also one of the area where universities can be involved. Then assessment of outcome of this initiative in future. For that purpose also universities can be involved. And for the house, let me say that if there is effective administration between the universities, between the animal husbandry department and the other components dealing with the livestock, say for example, in our state, we are the 4 components. University is there, veterinary university is there, that is LUAS Hisar, then Animal Husbandry Department, then Gau Seva Ayog, and Haryana Livestock Development Board. If all these 4 component pillars of livestock, they work together, and we have been working very effectively in Haryana, and this is the result that during LSD, it was, I think, the minimum mortality occurred in Haryana because of the reason that 4 components, that is the Animal Husbandry Department, the university, the Gau Seva Ayog, and the Animal Livestock Development Board, they worked together and checked that LSD in a minimum time period. So this can be the model for that. And moreover, the universities can also be involved for extension activities. Say for example, in Haryana we have our Pasu Vigyan Kendras, and through those Pasu Vigyan Kendras we are addressing the problems of the farmers, we are educating the farmers, we are disseminating the knowledge of laboratory and researches that we have in our university directly to the farmers for their benefit and welfare. So like this, that extension system can be implemented through the universities. Now, in the last one information I want to share with the audience that in the morning hours, Honorable Minister Rupala ji was discussing that alternative medicine or traditional medicine should be also taken into loop for addressing the issues of One Health. So, for the House, let me share that the Department of Animal Husbandry has already taken this initiative, and a high level committee has been constituted, and that is looking after the incorporation of this alternative medicine or Ayurvedic system of medicine into the minimum standards of veterinary education at UG level. And the coursework for that is already at the final state, and hopefully that will be incorporated in the newer minimum standard of education that will be coming in a very short period of time. So and due to this, I think we will be able to address the issues of AMR in the future, in the times to come, with the implementation of Ayurveda along with the present system of education. So thank you very much for involving me in this discussion. Thank you very much.
Thank you, Dr. Verma. So now, colleagues, we end with this presentation, this program. And I would request Dr. Abhijit Mitra, Animal Husbandry Commissioner, for concluding and wrap up of this session. Dr. Mitra, please. I think because a lot of time has already gone, so I think, okay. So colleagues, now we had a number of speakers from different sectors, be it medical sector, be it wildlife sector, veterinary sector. We had industry, then we had Dr. Butts from NDMA, and all research institutions, academic institutions. So I think it was a right mix. We also had community service organizations like Brook India CEO still with us. So thank you, sir, for your patience. And I think it was a very good session, and a lot of good points they have come up. So speaker-wise, I have also noted down what are the important takeaways which we would make a report. So I think it was a very fruitful session. We started late, of course, but having this kind of diverse and expert audience, definitely it takes time, because telling things in very little time is not always possible when people with vast knowledge, they are available here. So, but then I thank all of you for your crisp remarks and your patience for attending this session. Thank you so much. Thank you, everyone.
Yeah, thank you, R.K. Singh, sir. And at the outset, let me take this opportunity to place a vote of thanks on record to all of you from the department. Particularly, I am thankful to our secretary, sir. So generally, I was expecting that you will, after the program, you will leave, but your presence made us kind of this program very seamless, and we become really serious. Your presence make us very seriously and sincerely participate in this program. Thank you very much, sir. OPG, thank you to you also for your presence. Sumitji, thank you. And let me put on record my sincere thanks to each one of you. I may not be able to take the name for coming in a large number, showing your enthusiasm, active participation, and made us feel that we are really on the right track. And my only request from each one of you, let us have this enthusiasm little bit on for some time further. And what we would like to do, we'd like to, all these 8 verticals, let us have a specific deliberation, either online or physical, in a month of 2 or so that we have a much more concrete specifics to be noted down, and implementation and action plans can be developed. That is number one. Number two, if you have any suggestions and comments, don't stop here. Please feel free to write, email, WhatsApp, whatever you feel like. It will be recorded. Let me take also this opportunity to thank the team of DASD and the team BMGF, Bill Gates Melinda Foundation, and the MSLs and the other team who have been working day and night. I think last message I saw last night at 2 o'clock saying that good night. And I was telling, okay, whether good night or good morning. So it's a kind of a huge thing. And I must also put on record, I have been bothering my secretary for WhatsApp every now and then. And many a time it happens that before I send his next message, his reply come okay. So thank you for your okay, sir. It gives us a confidence. And I don't want to name anyone. In my apprehension is that we may miss people's name. So each one of you, a big, very big thank you from core of my heart. And if anything goes wrong, whole responsibility on me. I'll take the whole responsibility. Thank you very much.
Thank you very much, Dr. Mitra. Ladies and gentlemen, with this we conclude today's event. Thank you very much for your participation and support. And now we request the gathering to please proceed and join us for lunch organized outside the hall. Thank you very much. Enjoy your lunch and wish you a great day ahead. Thank you.